Okay, go.
Good morning and welcome to now 20 weeks of bringing you details, facts, and resources. This is Jametta Lilly, and I am delighted to be the co-moderator for another deep dive into a topic that's critical for all of us. And that's looking at racial disparities and how that is impacting our community, not only here in the city of Detroit, but indeed nationally. And so this is being brought to you through a very exciting partnership. Many of you have been part of the COVID313 Community Coalition for Families and Youth. So for 20 weeks, we have been presenting town halls in which we bring you facts, information, and support. And we're so pleased to be in a partnership now with Wayne State University, School of Medicine, and Karmanos Cancer Institute to dive in more deeply, to talk about not only the issue of racial disparities, but talk about it in the context of research. How can the community be part of this effort as we go forward? Because we know that the community voices must be heard. And as we think about that knowledge is power, we have this wonderful opportunity, and we're so glad that you'll be able to join us today. We have an exciting program, so we hope that you'll get comfortable. And I want to let you know that we always have translation available for you and a way to connect to us. So please, if you would, I'd like to start off with having our Spanish translation. Cristina.
Buenos días, yo soy la traductora Cristina Guzmán. Si necesitan traducción, por favor, hablen al número 626-7440.
Thank you, Cristina. And as you can see on your screen, we also have Arabic translation. And we'd also want to make sure that we have ASL. Julie, if you would interpret for us, please. Thank you, as always. So we're going to move forward with our program, and I'm so happy to introduce to you April Valoran, who is the director for Wayne State University's College of Nursing. Dr. April Valoran, welcome.
Thank you, Jametta. I'm excited that we're able to do this, and I'm actually not the director of the whole college. I'm just director of the PhD program and a professor at the College of Nursing.
Well, that's more than just a jest, but wonderful.
So you'll be able to ask questions throughout this proceedings with typing them in or texting them, and you can see that on your screen. So we hope you'll send us a lot of questions. We're hoping to make this as interactive as possible. This is going to be a wonderful presentation. I think you're really going to enjoy it. From there, I want to invite our first speaker, and that's going to be Haley Thompson. She's the Associate Center Director for Community Outreach and Engagement at Karmanos and a professor in oncology at Wayne State. Haley?
Hello. Good morning, everyone. We're happy to be a part of this morning. I'm going to give a brief introduction and then turn it over back to April and Jametta. You know, we're really pleased to be able to feature Dr. Wilson, the president of Wayne State University this morning, and we're working to kind of get him on the line. So I'll just give a quick introduction and turn it back over. If I could have the slides, please. No, it's the slides. Sorry, the slides available. I can't see the slides.
They are up. Let me try. Sorry.
Thank you. So first, I just want to provide some context for the webinar this morning, as well as last week's webinar. You know, we're really grateful to the COVID313 Community Coalition for partnering with Wayne State University and Karmanos Cancer Institute to talk more about the COVID-19 pandemic and emergency, particularly in the Metro Detroit area, and to think about, you know, sort of what's needed now in terms of what we can learn and how we can support the community through this time, particularly as it pertains to research and evaluation. This work is in part supported by the Provost Office at Wayne State University. Our Provost is Dr. Keith Whitfield, and he, a couple of months ago, put together a committee to build really more of a learning community around the social and behavioral determinants of health. So this committee has been moving forward in not only trying to share information and support work that focuses on the social and behavioral determinants of health, not only within the campus community, but also within the broader community. And our goal is to not only continue to build that community within the university, but to build partnerships throughout the city. And I still cannot see the slides. I'm not sure if they're up, but at this point, I'm going to just turn it over. I'm so pleased that this morning we can welcome the president of Wayne State University, a physician and researcher in his own right, Dr. Roy Wilson.
Hi, Haley, and thanks so much. I really was just going to join because I'm interested in the subject matter. Haley was nice enough to ask me to make some comments, but unfortunately, you can hear a fire alarm going off in the background here. For some reason, the fire alarm is going off in my apartment, and it's distracting to say the least, but you probably can't hear me because of the fire alarm in the background. So I'm just gonna hand it back over to you, Haley, so you can get on with your meeting. Let me just thank you for joining, and I'm very interested in what you all have to say. I know you have a great lineup of speakers, and so I'll just put my phone on my computer on mute now so you don't have to hear the fire alarm, and just enjoy the show. Thank you very much.
Thank you, Dr. Wilson. Haley, would you like to continue some remarks?
Absolutely. Thank you so much, Dr. Wilson. And I know that one of the reasons I'm really proud to be a part of Wayne State University and Karmanos Cancer Institute is related to Dr. Wilson's leadership in terms of connecting our faculty and our research to the Detroit community, and the commitment that's there to just really creating change, particularly when it comes to health and health outcomes in the city and even beyond the city. So thank you again for being a part of today. So if I could have the next slide. So I represent not only Wayne State University, but I represent Karmanos Cancer Institute, which serves not only Metro Detroit, but the state of Michigan. And I oversee, I'm the Associate Center Director for Karmanos' community and outreach engagement efforts. I oversee the Office of Cancer Health Equity and Community Engagement. And here's a slide with our staff, and Noel Larkin is our director. He's actually moving the slides this morning. So I speak on behalf of this office and Karmanos as well. And I'd like to talk about some of the work that we're doing, and particularly some of the work that pertains to COVID-19, because we not only these days are addressing issues around cancer, we need to address issues around COVID-19 as well. So first, I would just have to talk a little bit about our approach to working with community. And we kind of think about our work with communities engagement in terms of grass tops and grassroots. And the grass tops for us represent people in the community who are leaders and who are often decision makers and resource gatekeepers, folks who have access and are able to rally different types of financial, policy, and resource support. For us, that often is like the CEO of a nonprofit, like Miss Jametta Lilly, who's the head of the Detroit Parent Network, partially represents that, or the pastor of a church. So again, oftentimes those are some decision makers of organizations. But we also feel it's important to work with grassroots, so ordinary people who are local influencers in their communities as well. So those are kind of how we think about our work with communities. So first, I want to talk about some of the COVID-19 work that we're doing that is related to sort of our grass tops. And this is related to our, what we call, so you can go back one, our Research and Advocacy Consortium, right, or our RAC. So Karmanos, actually, many people don't realize this, because we are affiliated with McLaren Healthcare, we have cancer care sites all over the state. And what you see here on the map represents our catchment area, what we call our catchment area, 46 counties in the state of Michigan. And we have them divided into different regions, north, central, east, and southeast. And what you see here on this screen are some of the organizations, and it's a growing list of organizations that we formally partner with on research and outreach and education. And some of those are specific to the region, and some of those are actually statewide or represent multiple regions. So the first project that I want to talk about represents our work with some of these organizations. And this is something that is our COVID-19 Cancer and Community Survey. And this is a survey that we've just recently launched and that we are disseminating and sharing, not only throughout that's those 46 counties that I just talked about, but throughout the state of Michigan. We're interested in anybody who lives in the state of Michigan and is 18 years of age or older. So, and we really want to understand what impact has COVID-19 had on healthcare, especially cancer care. And when we talk about cancer care, it's not just about people who are diagnosed with cancer or undergoing cancer treatment. This includes detection and screening. So like mammograms, colonoscopies. It includes prevention, which includes things like HPV vaccination. So we really cover, we have a wide definition of what cancer care represents. There are actually 9 cancer centers across the country who are part of a group. And we're part of that group that are asking similar questions about people's experience with the COVID-19 pandemic and social distancing, and the changes that this has caused in their healthcare, cancer care, and even aspects of daily living and mood. We also ask a lot of additional questions about people's attitudes towards healthcare and research. For instance, how do you feel about COVID-19 treatment research or vaccine trials? We ask about your experiences of discrimination in healthcare, and also because we realize that this pandemic is taking place also alongside renewed activity around Black Lives Matter and addressing police aggression, particularly in communities of color. We ask about racial trauma because those experiences affect our healthcare and health outcomes as well. Next slide. So who can complete the survey? As I've said before, anybody who resides in the state of Michigan or age 18 years and older. It can be taken online or via telephone interview. It is available in English, Arabic, and Spanish. And people who receive the entire survey will receive a gift card. It takes between 20 and 40 minutes to complete, so online. It may take a little bit longer if you talk to an interviewer. And all the information that you provide will be confidential, or that anyone who completes the survey provides will be confidential. You can find more information about the survey at karmanoscancerhealthequity.org. So I want to talk a little bit just more about the partnerships that exist around the survey. So that's next. So as we were writing the proposal and working on this and developing this, we reached out to some members of that research and advocacy consortium that I talked about a few minutes ago. And so we actually have 9 formal partners who have worked with us and are working with us on this survey. The Area Agency on Aging of Northwest Michigan, LGBT Detroit, Access, our local American Cancer Society, St. Patrick's Senior Center, Western Wayne Family Health Centers, the Detroit Parent Network, the United Way of Gratiot and Isabella Counties, and the Faith-Based Genetic Research Institute. And these partners did a number of things. They helped review the survey and the questions that we were asking on the survey. They're looking at our translations, our Arabic and Spanish translations, to make sure that they're what they need to be. And they're also helping us to spread the word about the survey. So it was important to us in doing this that we did not do this in isolation, but we got feedback from our partners on the questions that made the most sense and that were appropriate for our communities. And in terms of the data, we're not only going to be looking at the effects of social distancing and COVID-19 on healthcare and on cancer care, but we want to share those data with these agencies, because we're going to have these data are going to give us, or the information from the survey is going to give us a greater insight into the needs of communities around the pandemic. And we hope to share that information with these agencies so that we can hopefully support them in better serving the broader community. So that's the first project I want to talk about. And then I want to talk about a second one that very much involves community members. So, and this is based on work that our group has done through what we call Michigan Cancer Health Link and our Cancer Action Councils. So these are groups of people we bring together, cancer survivors, caregivers, and advocates who provide their perspectives on the research of our cancer center. We provide some training in kind of research background, in terms of research, and we go through exercises and we get their research priorities that represent their communities. And we even ask them to develop specific research questions that we can pursue. Right now, we have them in 4 counties, 6 cities. We have 8 councils altogether with about 80 members across these councils. And since 2016, we've really worked to make their ideas reality. And in fact, since that time, we've received 4 different research awards that support the priorities that were developed by these community members. And these awards range in funding from about $20,000 to $3 million. So we really are committed in working in, not only to develop these ideas, but to, again, to make them a reality and actually conduct the research that the community wants. So next slide. So in keeping with this, we recently received funding from an organization called the Patient-Centered Outcomes Research Institute, also called PCORI. PCORI really works to amplify the voices of patients and community members in research. And so we're using that same model we did with the Cancer Health Link, and we're using that model to create a COVID-19 Action Council. And we hope to identify at least 16 Detroiters who are affected by the pandemic as survivors, caregivers, advocates, or first responders, to bring them into this council, again, provide them some background in research and develop and obtain their ideas about what are research priorities related to COVID-19, and what are some even specific questions that we should be pursuing in terms of research and evaluation related to COVID-19 that are the most relevant for Metro Detroit communities. So again, we are seeking people who want to be involved with this work. Next slide. So again, as I said, we're going to offer this training in research. We call it the Building Your Capacity curriculum. We want to host additional town hall meetings to share the work of this COVID-19 Action Council. And then we want to work with that council and other community stakeholders to actually branch out and build a community research review board for Wayne State University. Right now, all the research that goes through Wayne State University has to be approved by an internal review board that includes mostly faculty members and academics, but it also includes some community members. But this is a little bit different in that this would be all community members who can provide their perspectives and evaluation of the research coming through Wayne State University and make determinations of the benefit to the Metro Detroit community. Okay, go next slide. So I'm just going to end by sharing some of our partners here. It includes the Detroit Parent Network, the Faith-Based Genetic Research Institute, LGBT Detroit, and a national organization called Community Campus Partnerships for Health. So I'm going to just end by just, again, sharing all the info. You can find information about the projects that I've talked about on Karmanos, cancerhealthequity.org. There's our email address as well. You can feel free to reach out to me directly. And next slide. And I also want to just say, just with that, as we move through the rest of today's presentations, we really want to hear your ideas for research or perspectives on where you think we need to direct our research resources as it pertains to COVID-19 in the Metro Detroit community. We want to hear from community members, people living in Detroit communities, about what you think is important when it comes to COVID-19 research. And in November, we are going to be following up with one of our research symposiums on some of the work that's been talked about or that's going to be discussed today. So I'll leave it at that. Thank you.
And thank you, Haley. What is one of the reasons why we're particularly excited about this partnership is because we know how important it is that there is a participatory approach to research and how that research can inform us, whether it's academia, whether it's informing the governor's Racial Disparities Task Force, which Dr. Wilson is a part of, and I'm pleased to be a part of as well, whether we are informing the collective action that the coalition is engaged in. We are all interested in how the community can partner around complex and difficult issues, particularly as it pertains to social determinants of health, so that we can begin to zoom in on real solutions to address structural racism, to address the underlying causes of social determinants of health. So we with Detroit Parent Network really embrace this notion that we have this opportunity to educate, equip, and empower parent voices and community voices as partners with academia in this work. So having said that, and you heard an invitation from Dr. Thompson, you've heard the invitation from Dr. Wilson. We want to make sure that you can connect with us. So let me remind you, you can put your questions or information in the chat on Facebook. You may also text us at 313-288-2082. Again, you can text us at 313-288-2082. And we will be pausing after each one of our presenters to find out, in fact, if we have some questions. So this is my time now that I ask April, do we have any questions that have come in so far?
Thank you, Jametta. I don't see any in the chat, so please feel free to send your questions in. Haley, your presentation was inspiring, and it's wonderful that we're reaching out to all the communities. What would you say to the person who gets that feeling like, well, it's really interesting, I really like to, but I'm just one person. I probably shouldn't bother to reach out. What would you say to those people?
I would say that that's what it takes. It takes individuals coming together to make some sort of change and to have impact. You know, the people who sit on our cancer action councils and our different research action councils don't necessarily have, you know, higher degrees. They don't necessarily have any, most of them do not have any particular background in medical education or research education, but they're still experts. They have their lived experiences as a cancer survivor or as a COVID-19 survivor, you know, and you won't be alone. You know, we very much take a collaborative approach to working together, to giving people the resources that they need to have input into research and have input into the science. You know, that's what we call the curriculum that we offer, the building your capacity curriculum. We're building capacity, we're building ability to, again, be more involved in this type of work. So I encourage you, everyone, to at least explore the idea. If it's of any interest to you, you'll get a lot of support in working with our groups.
Thank you. And how can organizations become involved as partners?
Well, there are a couple of different ways. So for cancer, more cancer specific partnerships, certainly you can reach out to us at Karmanos Cancer Institute. For other areas, because we have expertise and research in all different types of chronic disease and conditions. One area where you can reach out is to certainly the Committee on the Social and Behavioral Determinants of Health that I talked about in the beginning. We also have an Office of Community Engaged Research at Wayne State University that you can reach out to, and we can afterwards share the contact information for that office as well.
Great, thank you. Jametta?
Yes, thank you. And as a reminder, it occurs to me, some of you that are tuning in to this two-part Racial Disparities Town Hall may not know who the Community Coalition for Families and Youth are. So let me share with you. We are a group of over 40 organizations. We are leaders of faith-based institutions, child and family agencies, foundations, parents, and all of us are focused on bringing information and using that information to build the power of our community to make change. So we are very much aligned in this discussion and interested in how we can ask the right questions that are culturally competent to get us some of the information that we need. So within that spirit is that we're so pleased to move forward and introduce some of the additional speakers that we have with us today. Our next speaker is going to be Dr. Ty Partridge, and Ty will be talking about the impact of COVID-19 on vulnerable families. Ty, welcome.
Hi, good morning. I'm really excited to be here, and on behalf of myself and my colleague, Dr. Chris Trinacosta, we're really excited to share some of the work that we've been doing for a long time now with United Way of Southeastern Michigan on this goals project. So if you want to move to the next slide. This is, you've heard that phrase, you know, it takes a village. This takes a metropolis. This is a very big project with lots of people involved. It was funded by a Social Innovation Fund grant to United Way for Southeast Michigan. The Social Innovation Fund program was run through the Corporation for National and Community Service. It ran from 2010 to 2016 and is unfortunately no longer running, but we were one of the last cohorts to get funded. The project was granted to United Way for Southeast Michigan. They're the host agency, and then they partner with, we've got 5 different community agencies involved in this project: Oakland Family Services, Care of Southeastern Michigan, Leaps and Bounds Family Services, the National Kidney Foundation of Michigan, and Access. And the Social Innovation Fund grantees require a very rigorous external evaluation, and Philibert Research and Evaluation are the primary evaluators for this. So if we move to the next slide, to tell you just a little bit about the GOALS program. GOALS stands for Gain Opportunities to Achieve Lasting Success. And this program is really targeted at low-income families with children between 0 and 5. It is a comprehensive, what we call a light touch service that provides a lot of resources and a lot of services to families that live in vulnerable communities, and who have been marginalized and don't have access to a lot of resources typically. And it does it in a way that doesn't require a lot of time and commitment on behalf of the parents. It really tries to reach them where they are. My colleague, Dr. Chris Trinacosta, will talk a little bit more about the family checkup model and how this program actually works in just a moment. So if we move to the next slide. Again, there's a number of agencies working with us on this project. It's one intervention, and we kind of think about this as one service provided by a number of providers, and it's really created a network of agencies that can share resources and share findings and share skills. And through these 5 partners, we really have been able to provide services to families clear around the Southeastern Michigan region, not just specific to Detroit, but the entire region as a whole. And they've done tremendous amounts of work. So to give you an idea about how this project began, we were first awarded the grant in 2016. This was the second Social Innovation Fund award that United Way had received. And we learned a lot from the first one about the need for taking the first year and figuring out what we want to do and planning and really getting everything set up. And then in October of 2017, we started a pilot phase of enrolling families, looking how the service was going to be implemented, and mostly collecting data. There's a lot of data collection and monitoring that happens. We ran the pilot from October through February of 2018, and then began full programming. And we've been doing that up until December of 2019 was the last time that we enrolled a family. And then we're continuing to follow families through the end of August. And that's when our data collection period will end. So if we move to the next slide. At this point, I'm going to turn it over to my colleague, Dr. Chris Trinacosta, and he's going to talk to you a little bit about what our sample looks like and about the family checkup model and what the program looks like. And then I'll come back and talk about some of the early findings that we've had.
Thanks, Ty. In addition to conducting research and teaching in the Department of Psychology at Wayne State, I'm a licensed clinical psychologist, so I provide training and support to this project. So I'll be talking about that in a minute. But first, I'm going to give an overview of the demographics. So if we could go to the next slide. So in terms of ethnicity and race, we're about half the sample, about half the population we're working with is African American, you know, a smaller percentage Caucasian non-Hispanic, and Middle Eastern. And then a very small percentage, primarily Latinx within that smaller percentage. Next slide. And so here's a little bit more about the population we're working with. One thing I want to point out specifically is the primary language. So you know, primarily the population we're working with is English speaking, but we're serving a large Arabic speaking population as well, and a much smaller population of Spanish speaking. If you can go to the next slide. And then because, you know, so many of us were concerned about health, it's important to think about health factors in these families. And so primarily the parents and children do have insurance, but they're primarily Medicaid. And then if you notice the lowest bullet point there, chronic health conditions. Over a third of the families face chronic health conditions. So these are families that, you know, are generally facing challenges, and especially during this time of COVID-19. Okay, so the next slide. So now I'm going to talk a little bit about the intervention. And so it is a research study. So the agencies in the field and their service providers, they are collecting the data, they are implementing the intervention, but we're also studying it and evaluating it. And what we're studying and evaluating is a program called the Family Checkup. And I don't have nearly enough time today to go into all of the details. I'd be happy to answer questions, or you can reach out to me after this. But the Family Checkup is essentially a 3-session intervention. It involves an initial interview where people get to know, where the service provider gets to know the family. Then they do a series of assessments. I'll show you in just a moment a little bit more about that. And then they do a feedback and goal set. And so in the intervention condition, they're getting that. In the comparison condition, they're getting some of the assessments, but they're getting much less in terms of the actual follow-up and goal setting with the families. And then when goals are set, referrals are made that, you know, ideally align with the goals that are set by the family. Okay, if we can go to the next slide. So this is just to give a very brief overview. On the left, what you can see here is the feedback form that the family gets from the service provider at the agency. For each domain, domains of child well-being, family well-being, and parenting, they receive feedback on whether this area tends to be a strength, and we like to highlight strengths, or whether it's an area that might be in the middle or might need some attention. And so we use motivational interviewing along the way when giving that feedback. And what we then work with the families on is setting goals. And that's what you can see on the right-hand side, is to set goals and to establish steps to reach those goals based on areas that the family may have that may need attention. And then we can go to the next slide. And this is just to give you an idea of some of the goal categories. So in line with our program being parenting focused on children, it's not surprising that the top goal needs and goal areas that families set are in children's education. These are younger children, but they you know, often are not yet in Head Start or any other sort of programs. That's a real need that we're noticing, and also in parenting skills. But what you'll notice lower down is that housing, mobility, food, those basic needs are often really big goals that are set as well. On to the next slide, please. And then we started this program in 2017, as Ty mentioned, and then 2020 COVID hits. And so now we're going to transition, if you can go to the next slide, into sort of what's happened with families. And Ty's going to present the data on this. I just want to very briefly say that we've also just heard from our service providers of how this has impacted families that are having much more difficulty getting the food they need, you know, obviously losing their jobs and things like that. And it's really been helpful for many of these families that they're in our program, because they already have a service provider that they're connected through the program that has been able to help them with those needs. And so now I'm going to turn it back to Ty, who's going to share some data on that.
All right, thank you. As Chris had mentioned, we've been working with families, and one of the things about the family checkup model is that it does develop a more of a social connection with the family service worker that puts them in touch with a wide array of services. So it really is helping them keep connected. Some of what we're looking at, we monitor and track 17 different domains of family functioning. And these are based on a data instrument called the Arizona Self-Sufficiency Matrix. And this is a way of looking at an overall family functioning and their risk for becoming marginalized or falling through the cracks or getting into an unstable situation. And some of our early findings, and I'll talk a little bit more specifically about some of them in a moment, is that once we saw COVID hit, and one of the things that we've kind of, I think, is going to be very useful in terms of providing data is that we've been following these families for about 1.5 years prior to COVID. So we kind of know what the lay of the land looked like before COVID hit. And then we can really start to tease apart the impact that COVID had. And what we're seeing is that we saw an increase in risk for inadequate healthcare, inadequate employment, decreased family social connections and social support from family, and increased family tensions, more disconnection from the community as a whole, and increasing parenting challenges and some increasing mental health challenges as well. That's when we look at it across the board. The good news about this is that when we look at the control families or the comparison families compared to those receiving the intervention, the families enrolled in the goals program, it does seem to mitigate the impact of COVID-19 by having them connected to this broader network of services and social connections. So I can show you some of the ones that are a little bit more specific if we go to the next slide to give you an idea of what this looks like. This is, I won't traumatize all of you this early in the morning with the details of the statistical models and all of that that's underneath this. But we were looking at during pre-COVID, what was the risk for these different domains. Once COVID hit, and what we're calling early COVID, this is a period from about March 12th to early April. And then what we had originally hoped would be post-COVID, because one of the things we're really concerned about with these families is that once the COVID crisis becomes under control, the long-lasting structural impact that these families will face and the risk that they might get forgotten as the economy recovers and things come back to some semblance of normal. We want to make sure that we capture that so that they don't get forgotten about. We'd hoped that this would be, the end phase, but now it's turned into mid-COVID as the crisis has continued to escalate. What you can see here is this is the probability that a family would be in one of our high-risk categories for healthcare status. And this is not having a doctor that they see regularly or having health insurance or unstable health insurance. And you can see that COVID increased the likelihood that they would come into this by about 2 times, although the intervention does reduce that. If we go to the next slide, we can see a similar pattern for employment. Employment was less of a concern during the pre-COVID as it hit the early COVID status. The probability of going into a high risk category for unemployment and underemployment really increased substantially, particularly for the comparison families. And the next slide, the risk of family connections and family supports falling off was really substantial. And you can see with the comparison families, almost all of them fell into this high risk category once COVID hit, because it puts more strain on families. It disconnects people from their families and their social networks. And the intervention was really effective at reducing this, although it's still having a negative impact. And then finally, looking at parenting, the same kind of pattern that we see with family strain, you're much more likely to be in one of these high risk categories for parenting. And parenting is looking at things like, feeling confident that you know how to help your child learn, feeling confident that you know how to work with your child, parent-child conflict. Those are some of the things that go into whether you're in this category or not. And, you know, one of the things about COVID is forcing everybody to be in the same place really has increased those parenting challenges for everyone. All right, the next slide.
And
So, yeah.
Excuse me, just a minute. This is so intriguing. I actually have a whole host of questions that we're hoping to be able to cover. And
Okay.
we know that we also want to make sure that we can open up for some questions. So if you would, if you could kind of give us a quick synopsis, and then we'd like to love to hear from the audience and to continue our discussions with other presenters as well. Thank you so much. Go ahead.
Fantastic. Yeah, what we're doing in next steps is we're really trying to extend the project so that we can continue to follow families into the post-COVID area. And also we've added 2 COVID measures that we're going back and asking families more directly, what is the impact of COVID had on you and your family? And I think one of the side things that's going to come out of this, and Chris can talk to this more than I can, is the way we've had to adapt services for remote service delivery. This was already a technology-supported intervention, but we've really learned a lot about how to do that in the COVID setting. All right, and I'm happy for any questions.
Thank you so much. This is pretty intriguing, and we all understand how COVID has created a change in all the plans that we initially had, which includes research projects. So at this point, April, do we have any?
I have not seen any come through. I think that they're busily typing them. Fabulous project. I'm quite impressed. Just out of curiosity, with all the adversity you're seeing in this population, are you seeing resilience as well?
Yes, and that's really where I think the intervention comes into play, is that there's already a social network, and that's one of the biggest risk factors for families who have been marginalized or live in vulnerable communities, is that they don't have that social network to help them connect to services that could support them. And United Way has this tremendous network of connections to services, and then we've made this personal connection with a family so that they know who to reach out to. And Chris could talk to a little bit more about the connections that they make with the family support workers, the family service workers.
The thing I'd add to that is that's exactly what our service providers say. It's the relationships with the families that matter. That's what's making the difference here. And they are seeing many families succeed through that the resilience is so important.
Thank you.
Yes, and we know, just as you found out that how important resilience is, we know that we are being adversely impacted by COVID. Social distancing is actually increasing that sense of isolation with families. So we've got a lot of reaching out and support to do. And you've created some tools and have partners that can share in that. So we'll look forward to hearing more information. And I really mean that, because what you're doing is something that I know many of the programs in our community would love to be able to reinforce and take a look at those tools. So we're going to move forward in our program, and we'll have Lance Gable, who is a JD in Michigan at Wayne State University. I'm so sorry, I almost said Michigan, right? He is at Wayne State University School of Law. If you would join us, Lance, to talk about legal and ethical implications of SARS and COVID monitoring.
Actually, I'm Dr. Ram. I'm Lance's partner in this project,
Okay.
and I'm going to start off the talk.
Wonderful. Thank you. Go ahead.
So I'm Jeff Ram from the School of Medicine at Wayne State University. On March 4th, I gave my last in-person lecture to medical students. And on March 10th, when the governor confirmed the first 2 cases of COVID-19 in Michigan, we were planning more studies on bacteria at the beach, as you see here. That's Jordan Neckfatel, one of the students that was working on that. And on organisms in the waters of Belle Isle, there's Mario McGee and Xavier Walker, who are current students at Wayne State that are working on this. But then You know, we were happy even staying at home to keep on working at analyzing data, but then three things happened. The number of cases of COVID-19 grew enormously. Secondly, we didn't hear from Marion Tate over here. She's our chief researcher on a project that we're doing with Detroit Public Schools at Belle Isle. And it turned out that she had COVID-19. And third, I became aware of the high mortality rate of COVID-19 disease among Blacks. John Lewis, of blessed memory, said, when you see something that is not right, not fair, not just, you have to say something. You have to do something. We knew we had to challenge the COVID-19 virus. With our experience measuring sources of disease at beaches. That may sound like a stretch, but you know, some of the sources will explain why that's relevant. Specifically, our bottom line is how can we determine where resources are needed in the community, and how will we know when a second wave of disease might be starting? Can we predict or anticipate that disease to place those resources where they're needed? We felt called on to start this project, and we still feel that calling. Can I have the first slide? So the first question is, how do we determine where in our city this disease is occurring? The map here on the left is from early May that shows where cases were reported in Detroit by individual testing. The mayor knew from this map where to deploy as many resources as possible. For example, that yellow spot that you see in the northeast of the city, that's where a nursing home is located, which since then the disease levels have gone way down and many people have recovered, but many have died. But testing, especially at that time, only looks back. We wanted to predict where the disease would be confirmed next. To do that, we considered where in the body the virus is located. In this image in the center, you see all the different organs. Well, it happens just about everywhere. In the lungs, of course, but it's also found in the stomach and intestine. And from there, we flush the problem down the toilet and it appears in sewage. Many laboratories around the world have found that virus can be measured in sewage. In some cases, up to a week before the first cases were reported in the community. In fact, I just heard a talk in East Lansing. They were sampling a week before the Harper Bar, which was a big breakout. They were detecting a signal in East Lansing from that breakout. Our project is to determine at a finer scale than an entire city what neighborhoods are most impacted. The question for the community is, and it's on the bottom of this slide, do you want to know if and when a second wave occurs, when the disease is active in your neighborhood? This question raises important issues of individual privacy and neighborhood values that might be impacted by these investigations. We're planning to discuss these issues in the neighborhood
contains health or health information. So concerns that we might have about privacy and about collecting information without individuals specifically agreeing to it in advance are also less in this kind of testing, because we know that we can't trace this back to any specific person. All that being said, that doesn't mean that there aren't concerns about privacy and consequences. So even though we can't detect a COVID case in an individual from wastewater screening, what we can do is identify communities that are potential hotspots for coronavirus outbreaks. And one thing that we need to find out in consultation with members of the community is this kind of information gathering okay with members of the community? Is it okay to search and to find this information, to publicize it? The benefits are increased testing, perhaps increased targeting of resources that communities need. The downside is the potential identification of that community as a COVID hotspot. And so this is an issue that we want to discuss with community members to see how they feel. Another concern that comes up in thinking about this from a legal and ethical perspective is how the information is used. So if the information is just being used for a beneficial purpose, here's a place we need to target more resources, here's an area, here's a community where we need to warn people that there might be an outbreak that's occurring and to be extra careful about their interactions and taking precautions, that's one thing. If the information is used to, say, target restrictions on that particular community, to say putting people in that community under quarantine based on a positive sewage screening, that would be more problematic from a legal and ethical perspective. And so there would need to be a really thoughtful discussion about how this information should be used and what's appropriate to do with information that's collected through this approach. I think it's essential that as we deploy new technologies to screen for COVID, we're making sure that we're not using this information inappropriately to target restrictions against communities, but rather we're using it to target resources to support communities. And that I think should be the key focus of these kinds of efforts. Using this information in a way that disproportionately targets restrictions on communities of color, for example, would be completely unacceptable. However, if we use the information to rapidly target resources to help those same communities to intervene more quickly to stop the spread of the disease, then that could have an incredibly beneficial impact and would actually reduce the kinds of racial disparities that we've seen so far in this outbreak. And so I'm going to stop there and turn it back to Dr. Ram. But I guess all I'll conclude with is to say that we really hope to have this conversation with communities around the city to determine how we can deploy this technology in a way that is most helpful and beneficial to stopping the spread of this disease.
So if you've switched it back to am I in speaker view now?
Yes, you are.
Okay, so so how are we going to do this? So the way that we've decided that we can work, many of those projects that are happening worldwide are sampling on a very broad basis. So for example, if in Detroit you were to sample at the wastewater treatment plant, you would be getting the sewage from approximately 3 million people spread all over Southeast Michigan. Obviously, if you got a positive signal there, you wouldn't necessarily say, okay, we're going to stop economic activity or quarantine 3 million people. You probably want to ask, well, what's producing that signal? And also, if there's one place out in the community where you've got a hotspot or an outbreak, it may not be detected when it's diluted by the sewage inputs from the entire population of Southeast Michigan. We do have a very large wastewater treatment plant. So for increased sensitivity and for targeting resources, we thought it would be better to sample in individual, what we call sewer sheds. Those areas in the city where, so for example, you see the green dots in the, just above my head there, that's that same area that where that nursing home was located. Or behind my head is the East Village. And the more bluish dots, that's around Wayne State and several hospitals. if we were to get signals there, we would know more where to place resources. So now in order to do this project, we have to go out in the community, pull manhole covers and sample there. And while we're there, people are going to be wondering, hey, what's going on here? And is this going to impact our lives? So before we do that, we want to talk to people in the neighborhoods. We want to collaborate with people in the neighborhoods, community groups. First of all, if we can meet with them, most likely by Zoom these days, first to inform them about the project and then to listen to what their views are on it. These questions that Lance raised about, do you want more resources targeted here? Do you want to risk possible public health responses, which would be for the purpose of protecting health, but might cause restrictions? Those sorts of questions and other questions that people in the community would raise that we in our ivory tower, so to speak, may not have thought of. So we'll listen and we'll evaluate what we hear and we'll respond. And if we feel that people in the community are welcoming us to do the project there, we'll come in, work on the project. And when we've gotten to a certain point, we will share the data with the community. And, you know, I think the public health authorities would be interested to know from the people in the community what the appropriate response should be to those results. So I've put on the slide here my contact information. So if you're part of a community group or even an individual that has a perspective on this, please send me an email or call me. We would like to make the appropriate connections, and thank you very much. We're ready to take questions.
Yes, thank you both. April, do we have any comments or questions that have come in?
At the moment, no, but I wanted to ask, are you working with particular organizations within the community? Are you reaching out to community organizations, or is it more individuals?
So at this point, we've been developing the technology for the project, but our next stage, in fact, during the next week, in fact, I reached out to Reverend Larry last week after his talk for the Brightmoor community to see if he could help arrange things. And I'll reach out to Haley as well. Her COVID-19 community council would be a marvelous way to interact with the community. So we're reaching out now. That's particularly why I put the phone number and the contact information there. And Cures, which is listed as a potential funding source, also has a community outreach council that we will be utilizing to reach out to community groups. So right now, this is why this talk was so important right now. We need to make contact with the community we want to, and we want it to affect our project.
Wonderful. And you're open to individuals as well as organizations contacting you?
Absolutely.
Great. Thank you. If you have other questions, please send them in through the chat so that we can send them forward. Actually, I have one. Is there a specific community or area Dr. Ram would like to connect with this project on?
Well, can the audience see the slide? The last
Yes.
slide shows the, well, it's right behind me. So there's several different sewage catchment areas. All those colored dots there show where it's drained to. The bright spots are where we'll probably sample any one of those. But I was particularly interested in the sort of yellowish group that's in the northwest area, because that's another area where COVID-19 was rather widespread in May, and I hope it's been, well, all over the city, things are much better under control. So that's a particular area. That's also near the Brightmoor community, and a few other areas. For example, the Northwest Community Center is in that area, and that is a gathering place for community groups. So if you're in that area, please contact us. But any of the others over on the east side, you see those two areas there. And yeah, those would be the places that I would highlight the highest. And notice the populations are limited. They're limited to tens of thousands of people. It also means that no individual would be highlighted as having the disease.
Wonderful, thank you.
Thank you. And thank you. And you should be aware that there are many environmental justice advocates and lawyers that are part of the COVID313 Coalition, and no doubt are listening. Many of the areas that you've identified, there are organizations that are very active in that community and could be excellent partners to help inform and move the results forward. And so importantly, that you're not talking about doing research that gets reported and put on a shelf, but how does that research then come back into the community with decision makers, both at governmental levels as well as the community, to have impact. So we're excited about that and want to encourage those of you that are listening that you can chat us through 313-288-2082. Again, that's 313-288-2082. So we're gonna move.
Could I just chime in and say, look, if you're listening and you don't see your sewage catchment on that map, but you'd like to see this project come to your neighborhood, please contact us. It's not a burden for us to map out another sewage catchment area. Thank you.
Thank you. That's exactly the kind of responsiveness and engagement that can make this work. Thank you so much for making that additional extension. And so we're going to move into one of our, towards the end of our program. We have two more, and we're hoping that you are staying with us, that you are checking the slides for the Arabic translation. It's wonderful. We have ASL and we also have Spanish translation. Our next speaker is Dr. Seth Norholm, and he is going to be talking about the Detroit Trauma Project, characterizing social support while under COVID-19 social distancing. This is absolutely on target and something that we're all wanting to hear more about. Dr. Norholm, welcome.
Thank you. Good morning, everybody. So I wanted to talk today about some of the projects we have ongoing. I'm speaking today on behalf of a very large research team of investigators housed at two relatively new entities here at Wayne State and in Detroit. One is the Neuroscience Center for Anxiety, Stress, and Trauma, or NeuroCast for short, and we're housed off Woodward Avenue in the building called the Integrative Biosis Center, or iBio. And also the Detroit Trauma Project, which is headed by Dr. Tanya Jovanovic, who is a longtime collaborator of mine. And while we're studying psychological trauma for the past 20 years as collaborators, it became clear when COVID hit that we really needed to turn our focus to this as not only a public health concern, but also a significant stressor that would need to be addressed at a community level. If you could advance to the next slide, please. So I first want to acknowledge the team that has been diligently working for several weeks now on this project. So within NeuroCast, I'd like to thank Rennie, Manessa, and then within the Detroit Trauma Project, again, thanks to Tanya Jovanovic, Anais, Sterling Karras, William, Miriam, Jakayla, Maura, and John. So this is clearly a large team effort. If I could have the next slide, please. And so what we saw do was really look at the interactions that occur when individuals are exposed to trauma. What we know from a long history of this work is that there can be barriers and factors, whether intrinsic or external, that can help when one is under an extreme amount of stress. And so it's become clear that social support or your network of friends and family can be a significant buffer. We started this project towards the end of May. And as you can see on the screen, we've got about 175 people so far in the study. Phase 1 will probably be capped at 200. And we'll take a look at the data. As far as where we get the funds for this project from, About 55% are from previous studies that our investigators have undergone, 28% from referrals, and then 17% from the Wayne State community. So we've done some advertising on Academica. We're averaging about 19 enrollments per week, and the individuals I mentioned in the previous slides are the ones doing the legwork of getting on the phone and contacting individuals. Next slide, please. So as part of this characterizing social study, like I said a minute ago, our recruitment was through previous studies, referral, and flyers through Academica. We sent out about 700 letters and 700 emails to individuals, and we also made about 1,000 calls or texts to individuals, with their permission to be contacted for the study. And that's what got us to our 105 number. And so we used 3 primary measures, 2 of which were administering an initial phone call with our investigative team. The first one is the fear of illness and risk evaluation, also called the 5, which is a 35-item questionnaire about infections and life impact, and in this case, specific to COVID-19. The second is a multi-item measure that we use called the Coronavirus Self and Community Screener, or CVS-CSS. And so what that enables us to do is ask about fears and concerns from the perspective of yourself, but also from the perspective of your community in general. Next slide, please. And then what we also did was we used mobile technology to create this measure that we could deliver through a mobile device and an app called Momentary Ecological Assessment, or MEMA for short. And what we were able to do was contact participants over the span of 15 consecutive days and have them fill out a questionnaire about who they've interacted with that day, the degree of the interaction, how the interaction made them feel. The interaction was on the phone or by text or an online application or social media, or whether it was in person. Then we asked about their feelings, and also we asked about stresses and challenges. And because of the populations that we work with, we also wanted to include in those stress challenges racial discrimination. Next slide, please. So to talk about our sources, we got them from academic and communities, and we also got them from 2 of our previous studies, being the critical periods and what we call the Scooby study, which is a longitudinal study that actually started recruiting 3 decades ago. Next slide. And our population is about 2/3 African American based on their self-report during the initial interview. Next, please. And it is a largely female population. Next slide. And then we asked the question about whether or not there was job loss because of 19. And as you can see, about 1/3 of the individuals that we've talked to were either furloughed or lost jobs as part of this COVID-19 pandemic that we're all dealing with. Next slide, please. And so what you can see here is some of the data that we collected during the few weeks of the study. And what you're seeing on the x-axis is, of course, the time starting in May and going to early June, and then the number of contacts either by phone or text. And you can see that we're getting a high level of engagement of individuals using their phones. And then on the right side, what you can see is we correlated in-person contacts on the y-axis and phone contacts on the x-axis. And there's a high correlation between contacts that are in person and contacts that are through a mobile device. So what this is telling us is that social individuals are social on a number of different platforms. It also tells us that that group on the far left is the group that we would believe to be, quote unquote, at risk for poor mental health outcomes because of the lack of social contacts. Next slide, please. And so you can see on the screen here on the left side, one of the items on the 5 is I use social media and FaceTime to stay connected to my friends. And as you can see that depiction there, all the participants who we've spoken to, with the exception of 9 out of 175, have been engaged in social media to some extent. So it's a very large component of daily lives. Looking on the right side, that's the coronavirus self and community scale. do you have a fear of loss of social connections or social isolation? And what you can see is a significant number somewhat agree or strongly agree that there is a fear of losing social connections. Next slide, please. So you look at the data we derive from the community coronavirus self and community scale. The question asks, is your community affected more than another community? And what you can see in that middle panel there, the individuals who identify as African American actually report a much higher degree of impact on their community. But then looking at the right side, the non-African Americans have more of a emphasis on their self versus their community. So we see sort of a switch upon the makeup of the community that we're speaking to. So if we can skip to the last in the interest of time, I'm getting hand waved here. One more. There you go. So what we found out so far with this group of 175 people is that the concern for a social system, both at the household and the community level, appears to outweigh concerns for at least in the largely African-American population that we've been in contact with. Support systems are made up of in-person and online connections. So we're seeing a hybrid of social networks. And our long-term goal is to see in 3, 6, and 12-month trajectories of individuals who are experiencing this COVID-19 phenomenon, and to see where they are in terms of mental health outcomes, PTSD, anxiety, depression. So we're going to use the data we've gathered as far as what social networks look like and how rich are they, and what are the mental health outcomes. I'm at my time, so I'll stop and answer any questions. And thanks again for the opportunity to participate.
And certainly thank you as well. I'm sure those of us in behavioral health are really very interested in many of the things that you're discussing. April, do we have anything that's come in so far?
Yes. How have community members been engaged with this process?
They've been engaged through the mobile app and through phone calls with our study team. The mobile app is administered daily for 15 days, and on average, most people will respond about 10 to 15 days. We've gotten a really robust response, and so our hope and our goal is that we will gather this information about community support, and the next will be to direct individuals to the appropriate places where they can receive care and support for whatever adverse outcomes may come up.
That was the other question I had, was if those people that you believe are at greatest risk for damage from this process and don't have the social support, do you have referrals or an intervention that will help them?
Right, so we're partnering up with community organizations, and that's one of the reasons why being part of this symposium was really important to our group, is that so we could identify other organizations that are out there in the Detroit metro area and Southeast Michigan, so that we know who to refer people. So we have connections already within VA and veterans groups, and with the Children's Center, for example. A lot of our studies involve families and adolescents, and so yeah, we're building a network of providers that we want to interact with.
Wonderful, thank you. Any other questions?
I think that we may have a few more, but we want to hold because it's important for us to hear from our last speaker as well. And we're being joined by Bertram Marks, who is from Wayne State University and doing some very important faith-based research. Bertram, if you would share with us now.
Sure, it's Bertram, and but Bert is fine.
Thank you for correcting me. I appreciate it.
No problem.
Bert, it is.
Sure. Yeah, I'm just first of all, I just want to say that the information received thus far is really fascinating, and I too would like to thank Dr. Wilson for Wayne State's very aggressive involvement in the community on so many different levels. I thought Dr. Ram's passion was right on point. And I think that level of community investigation and making sure that, and assessing and making sure that legal and ethical and privacy issues are observed, I think that is a critical part of building a better relationship between science and medicine and communities of color. The study that Dr. Norholm is doing, I think, is going to be an incredible benefit to the community. Once again, it is something that's desperately needed. People are holding back from seeking the help they need out of fear, and an examination of those fears and an assessment of what's actually going on in the community, I think it's critical to being able to help the community. I recently served as general legal counsel to the Progressive National Baptist Convention, which is an assembly of churches across the nation. They're headquartered in Washington, D.C., and it is an organization that's been around for years. As general counsel to that organization, I developed a relationship with its president, Dr. James Perkins. Dr. James Perkins had long expressed throughout his tenure as president of the organization a concern about the disconnect between African-American communities, academic and medical research, medical trials, the burgeoning science that is coming from the genome. And he expressed opinions about that a lot of different times. Throughout our discussions, we decided that we needed to act. And so we created the Faith-Based Genetic Research Institute, which has as its principal mission to bridge the gap between African-American communities, the trust gap between African-American communities and the medical community. African-Americans have a traditional mistrust of the medical community and the research community, and that's not without merit. There have been some incidents in the past that the Tuskegee experiment, Henrietta Lacks, just to name a couple, those instances just produced a great amount of mistrust, produced a great amount of anxiety when it comes to research, particularly medical research in the form of trials and in the form of participation, even in information gathering settings. We looked at a number of different studies that have taken place nationally, and they have assessed that the most trusted individuals in the faith community, in the African-American community, are faith leaders. And so we thought, let's get a team of scientists, let's get a team of faith leaders. Some of us are lawyers. I myself am a lawyer, but I also earned a doctorate in the seminary. So I'm deeply connected to the faith community, deeply connected to the legal community. We assembled this group for the purpose of crisscrossing the country with information, with armed with facts, with figures, having scientists that look like the community we're attempting to serve, do deep dives on explanations about why medical trials are important, why medical trials are necessary, what's happening with precision medicine, what's happening with gene editing. And then we started thinking about this in even a broader context after we sat down with Wayne State's president, Dr. Wilson, who himself, being a physician, has participated in medical research specifically designed to deal with issues and ailments that affect particular groups of people. For example, I believe Dr. Wilson did a pretty detailed study surrounding glaucoma and why it affects African Americans at higher rates than other groups. Sickle cell is another one of those types of diseases. And then there are others that have a disproportionate effect on African American communities. And so we began to have this discussion with Dr. Haley Thompson and with President Wilson and others about health equity, and to learn that Karmanos Wayne State through Karmanos was often examining health equity, or I should say health inequity. It became a natural fit that what Wayne State was doing and what we sought to do were really opposite sides of the same coin. And we should work together. We can work together, and we have been working together on a number of COVID-related activities, on general research activities. And I'm just really excited that this community focus has burgeoned, and Wayne State is leading this community focus, a top-tier research institution, top-tier research university, is taking a hardcore look at the population in the city in which it exists. That's 80% African-American. There are unique issues that confront the African-American community. And I'm just glad that Wayne State has decided to step up and look at it. And I'm also glad that many of the studies that have been discussed are focused on the broader communities of color, because there is an inequity and there is a gap. There is a knowledge gap. There is a participation gap. There is a service providing gap when it comes to medical services. And the way we bridge those gaps is by coming together. And I just really like the methodology that's being employed by Dr. Ram in terms of a community assessment and going into the community and saying, hey, do you even want this? Do you even think this is something that can help you? I think that kind of approach is an instant sign of respect, and it's a sign of, it speaks of the genuine nature of the exercise. And so, again, I am just happy to be a part of the community of research and study that's going on. I think the academic component, I think the medical science component, and I think the legal and ethical issues and privacy issues that are consistently being observed are really, really important to us reducing the level of mistrust and lack of participation, and actually creating the opposite effect, building that bridge between communities that desperately need to participate in these types of activities, a community that we need to understand better from an academic and scientific standpoint, and a community that will benefit in tremendous ways from us understanding, assessing, and analyzing data about their feelings, about their perceptions, about their fears. I think that is just an incredible journey we're on, and I'm excited. Dr. Thompson has been a tremendous asset, very diligent, and has involved us at so many different levels. I think that, again, Wayne State deserves a lot of credit for tackling equity issues, not just in this front, but on a variety of fronts. And I'm happy to be engaged with them in that regard. It's an exciting time. I think that we all should be proud of the work that we're doing in different silos, but it's important that we do what we're doing here today. Excellent presentation. I just thank you, Jametta, for all the organization. I know there are other people I should be thanking, but I just think this is an incredible forum and an excellent way for us to share what we're doing, so that there may be some overlap, but I think it's okay given the state of affairs today. So hope that wasn't too long-winded, but thank you for allowing me to share.
Certainly, and no, you weren't too long-winded, but you also did a couple very critical things as part of almost where our wrap-up is before we go into discussion. You lifted up the very issue that we know is always there, which is to what degree our communities actually valued and empowered and participatory in decision-making relevant to academia. And as you said, there's been a historical suspicion, but it's been based upon historical and real lived experiences, not only of African Americans in particular, but other people of color. So this is an opportunity and an extension of the university to say, we want to lead in this area, but we need to do that in partnership in an equitable empowerment relationship with communities of color in particular. So I want to pause for a moment to see if we have some questions, and then we'd like to move into some discussion amongst the group. April, do we have any questions that have come in?
Yes, question for Bert. What can allies, community groups, and staff on academic research projects do to assist in alleviating distrust of research and information collection?
That's a great question. And we've looked at that issue, and hopefully we think we have figured out how to do it. As I indicated, one of the most trusted leaders in all communities of color, but I'll speak from the perspective of African Americans, is the faith leader. Mm-hmm. And if we can obtain the trust and get the faith leader to develop insight into why this is necessary, then that's going to translate to the broader community, because once the faith leader, once he or she is speaking from the pulpit or speaking in various religious gatherings, it lends a certain degree of credibility to these issues. So I think that's the first place that we start. We have to educate the grass tops, and then we have to have the grass tops participate with us as we educate the grassroots, providing knowledge and information. And we're doing that through town halls. We're doing that through focus groups. We're doing that through literature. We're doing that by asking, researchers, like, for example, Dr. Thompson may be asked to come out and speak on a Sunday about the various research projects she's engaged in and why it's important, and how she came to think about the issues that she's studying. I think that information is a very powerful tool. And most often, we're not given the benefit of information and even exploring whether or not a particular study, a particular trial, we're not given the information about why it's important or if we even believe it's important. And I think, as I remarked earlier, that level of respect also breeds a great deal of trust.
Yes. So are you beginning to see with the work you're doing some improvement in distrust?
Absolutely. We've been very pleasantly surprised by how people respond when you give them the information. When you talk about, for example, the COVID-19 issue and churches shutting down and whether or not they should reopen, we've done some focus groups where we've learned so much information. We just, things that none of us could have anticipated came out of just that base level of exploring people's ideas and their feelings, their fears, and their plans. So we are seeing that, when science engages with the community, and it does so in a respectful way, and I cannot stress that enough, this approach that Dr. Ram talked about, where there's sort of an examination of the study, of the research itself, to determine, not from our perspective, but from the perspective of the group that we're seeking to impact, asking them respectfully, is this something that you even think is remotely beneficial to your community? That kind of respect breeds a great deal of trust, and we are seeing that people are just delighted when you come to them with a sense of respect for their community and their community norms. That's important. Respecting the community norms, respecting the community values, and not being shy about being deliberate in respecting those boundaries.
Thank you. That's a powerful message for those of us that are researchers to take home. We appreciate it.
You're quite welcome.
Yes, Thank you so much. And we're going to extend our time a little bit for about another 10 minutes. And I have the joy of looking out and seeing everybody that's on this Zoom call. And I kind of want to do a wave and a shout out to Dr. Ovetta Fuller, who has been, she is a virologist and has been so informative to us. So we'd like to kind of open it up right now to the audience and even the panel speakers. Around the issue right now is, what would you like to hear from the community that is listening now to help inform the work that we have? What are some topics or either information that you think would be beneficial? If we could perhaps do a little bit of a round robin. And Haley, should we start with you? And you're on mute.
Yes, sure. So what kind of, you're asking about what kind of feedback we would like from different segments of the community on our work?
Yes.
Yeah. Well, I mean, I think, you know, as I discussed a little bit during my presentation, you know, there's so many, you know, we're dealing here in this pandemic. It's literally called novel coronavirus, right? Novel meaning that it's new, you know, and so there's a lot that we don't understand about the disease and its impact. But you know what? I think a lot of people don't realize that the term research, what does research mean? At least in the academic context, in the university setting. Research is the process of creating new knowledge, right? Creating new knowledge. So, you know, part of that, as I say that, I think that what we really need to hear about from communities is, or sort of, what are the areas in which they've been most impacted by COVID-19? And where should we start in terms of creating that new knowledge for this novel, you know, the impact of this novel coronavirus? You know, and there are a lot of different areas. Certainly there's the medical aspect. You know, one of the topics that the National Institutes of Health is focusing on now is sort of not just the impact of COVID-19, the disease itself, but how does it affect people in general in terms of living under the stress, living under the isolation, and how's it affecting how people manage other types of chronic disease? And I know that's an area of focus for Dr. Valoran, who is a PhD and a nurse. You know, how's it affecting people who already have to deal with their hypertension or their cancer or their diabetes or their asthma? So, you know, that's an area that I think we need to learn a lot more about, is sort of how people's overall health is affected by not just COVID-19 and the disease and the virus, but also by the conditions that it creates. So I'll leave it there.
Would any of the other panelists like to pose a question or take that question on?
I'd really like to know what COVID-19, I would really like to know how it has impacted people's personal view of life expectancy. You know, has it impacted, you know, what was your expectation before? And has this lowered your life expectancy expectation? I think that's critical because it will determine what steps people take to prevent it and what steps people will take to engage themselves in preventative medicine as a whole. So that is a question I would like to know. And secondly, I would really like to know, and I'm thinking we would probably all would, I'd really like to know the specific financial impacts that COVID has had. For example, the single mother who has 3 kids, they're all school age. The kids are not able to go to school. She is employed, but she's underemployed, so she cannot afford daycare. They're not in school. They're too young to be at home by themselves. She can't afford to bring somebody in. She can't afford to work from home because she has a job where she has to go in. You know, what decisions is she left to make? Does she support reopening the schools because of her financial and social condition? If she doesn't support reopening the schools, what plans is she contemplating to educate her kids? Is there a network being built through her family? I'm really curious about those tough choices that people are having to make because of of COVID-19. And I'm just wondering how they plan to navigate it, especially as it relates to parents of school-age children who are either employed at a base level or underemployed. How does this impact the decision to send people back to school? Because quite frankly, it seems like the science is telling us it's a bad idea to go back to school, but that's easy for a 50-something-year-old man with no school-age children to say. So I wonder what those mothers, and I'm really curious about what the research tells us about the choices they're making, their fears, their concerns, how they plan to navigate it, and that life expectancy issue.
What I would like to do just before our next speaker is to invite all of you, part of the Wayne State team, is to dive into now 20 weeks of town halls that the Community Coalition has been doing. Because at every one of those, we have powerful parent voices that share exactly the kind of experiences that you're talking about. And I would dare say that some answers and some provocative opportunities for how we can be relational, culturally competent, and equitable in how we get to those kinds of studies, as you've mentioned. So I want to encourage all of you to take a look at the One Detroit site, where you can see the previous weeks and hear parents really talking about their lived experiences. I believe we have a few more people that are going to add some comment. Please feel free.
So one of the questions I've been wondering about, and I'm certainly going to contact Kelly about this afterwards, is a question about malnutrition and how COVID-19 has affected that. In cancer treatment, 30 or 40% or more of cancer patients are malnourished. It affects their treatment. And I can imagine, and you'll be collecting data on this, that with the economic impacts, malnutrition will also increase. That would be another concern I would like to know about. How does COVID-19 affect cancer treatment, particularly through the nourishment that people who have it get? And obviously, the questions that Bertram Marks just raised about the economic impact on children and families is something else, but these are big effects of cancer.
We're down to about our last 3 minutes, but we can certainly hear from Ty. You lit up. Go ahead, please.
No, I think just to follow up, some of the domains that we've been following with the Goals Project are food and access to food, and the intersection of food access and transportation and employment. I think I would totally agree that that's really one of the things that we really need to look at, is looking at this holistically rather than looking at just each domain separately. But this is a multi-systemic issue. And I think from, what I would like to hear from communities and individuals listening and watching, I mean, we're providing data based on what, we've learned from folks in the community about what they're telling us about these issues, but how do we translate that into more effective systemic policies? A lot of times we'll get an idea based on research and we'll say, oh, this is how we should address it with a policy, and there's all these unintended consequences, or there's different ways that it doesn't fit with community norms, and learning, what's the best way that we can understand what we're finding from a community perspective. What's the community context that would explain some of the findings, and what would be good steps about moving forward. One of my biggest concerns about COVID is that, communities that were already marginalized, already facing systemic discrimination, already having a lot of social structures as barriers, it creates an even greater impact on the community. But these are generational impacts that we're going to see now. These are things where kids are going to be, you can't make this up now. You have, loss of parents, loss of family, loss of income that is going to have ramifications for multiple generations. And how do we think about supporting the community that way?
Absolutely. So how can the right questions inform us for collective action, which has to include policy? Seth, if you would, and then we'll be wrapping up right after you, please.
Yeah, I just wanted to follow up. You know, last week, one of the speakers brought up the idea of food insecurity. And that's one of the issues that we've been able to collect data on as part of the study. And not surprisingly, there's a significant number of people who express fear concerns about not having the resources they need. And what that brought to mind for me was in the wake of Hurricane Maria a few years ago, we had an NIH council, and we were talking about how to help individuals in Puerto Rico after that hurricane. And, you know, you can talk about interventions in terms of what can we do psychologically, you know, what things or what interventions can you do to help people that have been traumatized. And one of the people who was representing the Puerto Rican community said, the biggest thing is means, you know, forget therapy, forget cognitive strategies. We need food, we need a roof over our head, we need dry bed to sleep in, and you provide those means, and so many of these psychological outcomes drop without any intervention.
Yes, thank you so much. That was a perfect reminder. The subtext of our work, right, Dr. Haley, is looking at the social determinants of health. I would argue that we need to always be talking about the socioeconomic determinants of health. And you just mentioned that. It's very difficult for people to focus on their health or even their disease that they could perhaps manage when they don't have access to those basic fundamental needs. Dr. Haley, really quickly, and then I have to close this out because I see that we have some wonderful people that are part of our next program. Go ahead, please.
Oh, I was just going to say that, you know, in terms of just bringing it back to the social determinants of health, you know, it's important that we understand all of this in the context of communities. And we cannot do that without community partners, the people who actually live in those communities. And I hope that, you know, just the participation of everyone today just reinforces that.
Okay, great. Thank you so much. So what we'd like to do is we're getting ready to transition. We have something very special for you after the program, and that's Queen of Yoga, Kimberly Boyd, will take us through a yoga session. But we also want to let you know the coalition is going to have its own deep dive into education, part 2. Just like we had racial disparities last week, the coalition had a deep dive on education and all the kinds of questions that we know parents and family and other community leaders have around education. So we want to make sure that you stay tuned for Kimberly Boyd before we go into our 12 o'clock program around a deep dive for education. There's also an evaluation that is in the chat. Please fill that out for us. We want to know, how can we make this more relevant? Did you get good information? What do you learn? And make sure that you put your name and email in the chat. So if you would like to be able to be part of our ongoing communication. There is also a parent survey in the chat. Parents and families, you know we need to hear from you. And that particular survey is actually being used across the city of Detroit with our own Hope Starts Here and City of Detroit working closely from the children and families, and all of us asking for your opinion and concerns and ideas about going back to school. So before we get ready to go, again, please make sure that you participate in the evaluation. Parents, there is a parent survey there for you. And as we get ready to close, as we do with our regular programming, I'm going to ask everyone if they would light up the screen so that the audience can see all the people that have been involved in this effort and also transitioning to our new program. So with that, Detroit, stay safe, stay healthy, stay strong. Thank you.
Bye.
And 1, 2, 3, Kimberly, you've got it. Wayne State, we're off the air. Thank you.
Thank you again so much for this opportunity. Jametta and COVID313 Community Coalition, we so appreciate just, you know, you're working with us and integrating us into your process. This was like, you know, it was fantastic. Thank you so much.
COVID313 Coalition is full of wonderful and I believe unprecedented collaboration and lack of ego. We're all here to help serve families and take us forward. I think that for all the speakers, we're going to make sure we need to turn off our video because so the new program can begin. We're on the same Zoom. Thanks so much. Be blessed.
Thank you.
Thanks.
All right, good afternoon, everyone. I'm Kimberly. Is everybody ready to do a little yoga and get back into their bodies? So the key words that I was given to help frame our practice today are calm and relaxed as we make this transition in programming, and also think about getting ready to go back to school. And certainly being calm and relaxed is really important to our ability to be able to learn well. So wherever you are, I invite you to just sit up tall if you are sitting, okay? And just take a nice easy breath in, bring your shoulders up, and let them come down as you breathe out. And let's do that again a couple more times. Breathing in, bring your shoulders up, and as you exhale, make that sound. And one more for me, we'll make 3. Breathing in and exhale. And now return to your own natural breath. So everybody has their own special way of breathing. So if you would do this right now, just rub your hands together so that you can warm them up. And let's see what you can notice about your breath today. Take one hand and place it on your heart. Take the other hand, place it on your belly. And now just notice your breath. Notice that there are 2 parts to your breath. The part where you breathe in, and of course the part where you breathe out. So this time what I'd like you to do is think of this. As you are breathing in, think of filling a balloon so that your belly gets nice and round. And as you exhale, blow out through your lips, sort of like the air is going out of that balloon. And try that again, breathing in and breathing out. One more, we'll make 3. So on your own, breathing in and allow that balloon to fill and expand, to bring in more breath. And as you exhale, release it, clear it out, let it go. And now once again, sitting up nice and tall. Feel the strength of your spine. Feel your feet flat on the floor. In yoga, we would call this mountain pose because mountains are strong, they are consistent, they last a really long time, and they can see everything. So from here, let's see how wide your mountain is. Just bring your arms wide to the side. Make sure you're not touching anything or anyone. So if you're home with your family, you might have to spread apart a little bit, okay? And bring your arms down. Let's try that again. Bringing your arms out, breathe in. See how wide your mountain is, and exhale, bring your arms down. Beautiful. Now let's see how tall your mountain is. Your feet right there on the earth, nice and strong. Breathing in. This time, bring your arms up as far as they can and look up to the very top of your mountain. See how tall it is. And then as you exhale, bring your arms wide and to the side and bring them down. Beautiful. I'm going to try that again. Ready? And breathing in. See how wide your mountain is. And exhale and leave your arms here. Take another breath if you need to and reach up. And while we're up here, let's just climb that mountain, reaching one arm and then the other, breathing naturally. Notice that your body may be moving gently from side to side as you do so. Okay. Ready? And stop right there in the middle. Let's go back to seeing how wide our mountain is. And now while your arms are wide, I wonder How tall? How far down? Can you see if you lean forward? See if you can see your feet. So what we've done is we're leaning forward in the support of the chair with our arms out and wide, kind of look like you're looking over the cliff of your mountain. Breathe in, spread your arms like wings. And this time as you exhale, bring the arms down and see if you can reach down toward the floor. Now, do not worry if you cannot touch your feet. As a matter of fact, if you can find your lap, you have a place to rest your arms so that you can look over the edge of your mountain. Breathing in one more time. Sitting up nice and straight and tall. Bring your shoulders up and rest them down. And now breathe naturally. Okay? Bring your hands, one hand back to your heart, one hand to your belly. Notice how you feel. Notice how you're breathing. All right, did you get that? So I want you to know that all the yoga that we do can be done from sitting down or standing up. So we're going to say it's yogi's choice or yogini's choice. If you want to stay seated, you're absolutely welcome to do that. We just showed you what your practice looks like. If you want to stand and try the whole thing again with me, I'm going to move back so you can see a little bit more of my body and we will try the idea again. All right, so now I like to keep my chair nice and handy in case I need to hold on. All right, so now can you see my whole body? All right, so here I am on my seated mountain. Right now you can see my whole body. So once again, my arms wide to the side, the mountain's nice and wide. I have lots of room. Okay, breathing in again, nice and tall. I can see the top of my mountain. Breathing out, breathing in, coming forward, leaning forward in my chair. Okay, so your hands can go all the way down toward the ground or they can rest right here on your lap. All right, so that's a seated version. You see my whole body. If you want to stand with me now, because mountains, some mountains are a little bit taller than others. So now we are in our standing mountain pose, nice and tall. And I wonder if you were going to think of some words in addition to strong and dignified for mountains, what's a really cool thing about a mountain, right? So from here, breathing in, let's see how wide your standing mountain is. And exhale, bring your arms down. With our next breath, let's see how tall our mountain is. Inhale, bring your arms wide into the side and up. Look all the way up to the top of your mountain. And now let's go for a climb. Right, so now we're standing. Keep your feet connected to the earth. Try not to lose your balance, but if you do, just get it back. All right, so reaching. Now we're at the very top of the mountain. Let's start our climb down. Breathing in to reach up. Exhale, bring the arms wide into the side. All here. Inhale, we're standing. So what we're going to do is fold our body forward halfway. Inhale, open your arms like wings. Exhale, now bend your knees. Did you know that yoga poses are named after things and named like mountains and also furniture? So if your knees are bent and it looks like you're sitting, guess what yoga pose this is? You got it. This is chair pose. So now I'm going to give you the side view. My chair was there, but I'm not really sitting, right? So now we can really feel the strength of the mountain as we are using our nice strong legs. Breathing in once again. Exhale, press the bottoms of your feet and come up slowly, peacefully, gradually, kind of like you're coming up in an elevator. Inhale, bring your arms wide into the side again. And exhale, this time we're going to bring them down in our traditional palms together pose, namaste, which means I see you. I see how strong you are. I see how kind you are. I see how smart you are. I see how patient and resilient you are. And because I see all those things in you, we get to reflect them back so that they come to me as well. All right, so standing here, now let's take a look to one side of the mountain. We're just going to twist to one side, breathe in, and exhale, come back center. Inhale, lengthening up the spine, and then exhale, rotate to the other side, view of the mountain. Inhale, come back in. We're going to try that again, but just in case you're worried about whether you can do that sitting down, of course you can. Inhale, lengthening up to the crown of your head. Exhale, twisting to one side. And exhale the breath as you come back in. Breathe in and exhale to the other side and come back. All right, so now what we're going to do is cross one hand over to the opposite knee. This is your seated version. And we're going to take one arm up, wave to the top of your mountain, and then bring that arm over your head. Then inhale, reach up to the clouds, and exhale, bring the arm down. And on the other side, inhale, bring one arm up, wave to the top of your mountain, exhale. Inhale again, exhale, really feel the side of your body opening, reaching up, and exhale, bring it down. All right, if you're seated, do that again. If you're standing, this is what we're gonna do. We're gonna cross one arm behind our back, okay? Inhale, one arm up, wave to the top of your mountain, exhale to the other side. Inhale, reaching up toward the clouds, and exhale, switch arms, all right? Inhale, reaching up, wave to the clouds. Exhale, reaching over to the opposite side. Inhale, reaching up, and exhale, both arms down. All right, everybody, whether you're sitting or standing, both arms wide to the side. Let's visit the top of our mountain. Now this time we're going to climb down the mountain. All right, we climbed up, so this time we're going to climb down a little lower. A little lower. You can decide how far down your mountain you're going to climb today, right? If you are using a chair, there you are sitting in it. If you're not using a chair, you could have made it all the way down to the floor, or you could be standing here. But once again, to bring our practice to a close, inhale, both arms widen to the side. This time, exhale, open them here. And again, inhale, open to receive, to accept this breath. Exhale, clear it out, empty it, let it go. So now, inhale, almost like we are inside the biggest balloon. Exhale, bring your hands back to center and returning to the place where we began. One hand on your heart, one hand on your belly. Breathing gently and peacefully. And when you are ready, just bring your hands gently to your lap. And so I invite you to, every day, especially as we are learning, take some time just to reach and stretch your body. Right? And so I wonder, what would you name this mountain? We began with mountain calm and relaxed. Are you feeling calmed and relaxed? Maybe energized, peaceful, or whatever it is. May you be well. May you stay well. Thank you so much. Namaste.
Namaste to you as well. Kimberly, thank you for reminding us that in this unprecedented time, we have to not only tend to our bodies to keep our immune systems up and stay healthy, we have to tend to our feelings and our spirit. So thank you so much for doing that. And welcome back, all of you who are returning for another segment of the powerful work that the COVID313 Community Coalition for Families and Youth are bringing to you. My name is Jametta Lilly, and I am blessed to serve as the CEO of the Detroit Parent Network. I am also a proud member of this coalition, a proud Detroiter, and yes, I am one of those women from Michigan. So we have a very special program that we're continuing with you today. From last week, we began to do a deep dive into education, and we're going to continue to have that dialogue today. But before we do, for those of you who are just joining us for the first time, the Community Coalition for Families and Youth is comprised of some 40 organizations, awesome, committed, anti-racist, and towards uplifting our community. Our organizations are faith-based groups. You see the slide. We have community agencies. We have foundations with us because we know in order for our community to thrive, all of us have to come together to support each other. And so what we'd like to ask you to do is begin to get comfortable. And I want to make sure that, as we always do, that we are inclusive. So in that sense of inclusion, I'm going to ask our various translators if they would translate for us. Saeed, if you would translate the welcome for us, please.
Saeed is not here yet.
Okay, then we'll have a slide that will be available for our Arabic listeners. You can see that slide now. We'd like to move forward then, if we could have Spanish translation, please.
Si necesita traducción en español, por favor, hable al 313-626-7440, 313-626-7440.
Thank you so much, Cindy. And may we have ASL, please? Julie, thank you. And so as co-moderator, I have the joy of working with not only the COVID Coalition that's part of this production, but also Christine Bell, who will be joining me as we co-moderate this very important segment. Christine, how are you today?
I am well, Jametta, thank you. It's always a pleasure to see you virtually.
We've been hanging out doing this for a while.
Yeah, I'm waiting for the day when we can see each other in person. I'm Christine Bell. I'm the Executive Director of Urban Neighborhood Initiatives. I'm a mother of 3 very energetic youngins and very proud member of this coalition. And I'm the co-moderator for today's town hall. And we've got an exciting lineup of speakers today. We're going to hear from our medical community about going back and reopening our schools. And then we're also going to hear from our schools today about their reopening plans and give you all an opportunity to ask your questions. We had a lot last week, and so we anticipate we'll have even more this week. And so we want to definitely encourage you to ask your questions, and you do that by putting your questions in the chat, the Facebook chat, or you can text them to 313-288-2082. Again, that number is 313-288-2082. And I am going to hand it off to Cindy Gamboa, and who is going to help us with moderating today. Cindy?
Thank you, Christine. And hi, everyone. Cindy Gamboa. I'm glad to be back. It feels like we've been doing this for a whole long time, but each time we open up the screen, it feels like the first time again. So thank you so much for allowing me to talk to you today. I am also a mother of 3 beautiful children, very energetic, like Christine talked about her babies. And before I start and jump into our program, I just wanted to take a pause really quickly. And we've done this format in the past where we just give a little bit of reflection just from the parent point of view. And there's a lot of conversations that are happening right now about school reopening. And a lot of it seems a little bit daunting. A lot of it is confusing. We're in uncharted territories. There is not a prescribed plan that COVID is taking, right? It's very unpredictable. There's a lot of unknowns right now. And as you guys have been hearing from experts, they're still trying to figure it out as well. So I just wanted to take a pause and reflect on, where we've been since March. We were in a state of not knowing very much. The daily COVID tests, like the cases were steadily inclining, and schools were closed. We weren't sure if they were safe or not. And it feels like we haven't gotten that far, right? So we're glad you're tuning in because we're doing the best that we can to line up a panel of experts that can tell you everything they've learned, because things are changing every day. It's really hard to keep track of everything. I'm a parent to a toddler, a middle schooler, and a high schooler. And I'm torn between where I stand because each one of my children is going to need different approaches when it comes to learning, their education, and their needs. The conversation about schools reopening is something that I think about from the moment I wake up to the moment I sleep, and probably even dream about it. I want experts to be prioritizing Lily, Christian, and Humberto's health and well-being, as well as their education, any educational opportunities so they're not left behind. So today, I wanna tell you parents listening out there that we have to have the confidence in knowing that our school leaders are gonna make the decisions thinking through all of the details, but making sure that you raise your voice, ask the questions that you have on your mind. Your voice is just as powerful and important. So please continue to look for avenues where you get that information. Thank you for tuning in, and I want you to take advantage of our chat feature that we have today. So stay tuned for the next 60 minutes. We are gonna have a panel of experts that are gonna be talking about health and about school reopening. So please use the chat feature to text and you can also text your questions to 313-288-2082. Again, that phone number is 313-288-2082. We're gonna have a Q&A section after each segment. So please go ahead and text your questions as they come up, and then we'll go ahead and come back to those. If there's any questions that we don't get to on air live, then we will be committed to making sure that we post those questions and answers on onedetroitpbs.org in the future. So before we start, for our experts, I want to remind you to please speak slowly for our translators. They want to make sure that they're translating the important information that you're sharing with us correctly. So please speak slowly. And then we are asking you to also turn off your camera when you're not speaking. And this is to ensure that our ASL interpreter can be seen for people that need that service. We also ask you to mute yourself when you're not speaking, because background noise, even though it sounds quiet, they will also show up in our recording. Terry Whitfield is helping us today as our timekeeper. He's gonna keep us right on task. So please, if you're running over, he will gently remind you to wrap it up so that we can continue on with our segment, okay? Christine, any other thing that I may have missed?
No, you have it all, unless you want to just give folks the translation one more time. Is Saeed on?
No, Saeed is not on.
Okay.
So I'll share the information for the Spanish translation. So si se acaba de sincronizar, por favor, únese para la traducción en español. Habla al 313-626-7440. 313-626-7440. And the information for Arabic speakers is on the screen. So if you need to tune in for that information, it is there. Okay. Can we have our ASL interpreters share the information for ASL interpretation one last time? Okay. Thank you so much. We're going to go ahead and get started. As Christine shared with you guys, our segment today is very important. We're talking about reopening schools from the medical perspective. So we are going to open up with a panel of medical experts. First off, we have Dr. Oveta Fuller from the University of Michigan that will be sharing important information with us. Dr. Fuller.
Yes, good morning or good afternoon. It's good to see you all again. I am really don't have a whole lot of new information for you. I'm going to show you a couple of things that hopefully will help us think where we are. If I can share my screen for just a second. Hopefully you can see this. Is that correct? What about school openings?
Yes.
Yes?
Yes.
All right. So this is, as you know, not a simple topic, and I so appreciate what I've heard so far about the issues that are there. And I've actually been in conversation with a number of people since the last time I was with the coalition, the statement I made about if I had young children. And I realized there's so many other people in very, 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 very different circumstances. And so this is not simple. This is not a fix. There is no fix. So what I'd like to do is just remind us where we are. This slide shows you the virus. Remember, this is a respiratory virus. It's particularly very good at reproducing, and each cell produces many, many, many viruses. So this is a patch of one cell where you can see projections from the cell, as well as the many viruses that are formed just in replication in one cell. So imagine that if you're talking or singing or sneezing or almost anything, breathing, and this virus is in your respiratory tract, that you're going to put it out into the environment. This shows you where we are in the US. These data are a little bit older, but they haven't changed. We're still going up as a result of exposures that happened Memorial Day and after that. This shows you where Michigan is. We have handled it much better than many states, but we also are on a trend up, and that will only be controlled when each person takes responsibility for doing what they have to do. And the last of these slides I want to show you is just a reminder of how to manage coronavirus transmission. We will be managing this for years. I know there's hope for a vaccine and the hope for much lowered transmission, and I hope we can get there. I believe we can, but even so, it's not going away. This virus is going to be here at some level, much like HIV has been here for the last 30 years. So this simply shows you the risk factors as our governments look at what to declare as the state of operation for businesses and schools, that the highest level of transmission is from an asymptomatic person to an uninfected person. And we know that between 3 and 5 days after exposure, before symptoms present, is when a person is most likely to be projecting virus or to have the highest levels of virus that they can transmit to someone else. That person may be asymptomatic and never show symptoms, or that person may be pre-symptomatic, meaning the infection has occurred, they're on their way to symptoms, either mild or severe, but at the 3 to 5 days is when they're most infectious. So how do we prevent the virus from circulating in the community? At the highest level of transmission is between someone who's asymptomatic and someone who's uninfected with no mask or no protection. This is where distancing is so important. The next level is between someone who is asymptomatic and then a person who is uninfected has a mask. This is higher because this person is the one projecting the virus. A lower level of transmission is when someone who is projecting virus or infected has a mask. The virus will be retained, hopefully, in the mask and not get to the uninfected person. The low level, even from that, is when both people wear a mask. So this person's virus is not getting out and this person is not breathing in material. And then, of course, if you add the physical distance to the mask, you have even greater or less risk of being infected or transmission. And finally, almost none if we actually isolate ourselves from one another.
No.
So hopefully this chart is useful. And then the very last thing I want to share is,
actually, that's specifically stated in the transportation. That
I'm hearing another sound. That's not me, right?
Ride the bus, so that's important.
So this is from the CDC schools during the COVID-19 pandemic. Just to say there are guidelines and tools to help schools decide where they are and what to do. And so if one can meet the considerations of protecting children and employees, screening students and employees, and this is not involving testing, this is essentially screening on site, then you can proceed. If all the questions are yes, you proceed to the next step. And so this is a guideline that helps those who are trying to determine about what to do, figure out how to manage the situation. It's not simple. It will be different in different places. And thus, there's no simple answer. We really have to protect our students, our children. Our children should be our first, in my opinion, priority. Yes, the economy is critical. And of course, parents have to find ways to support economically. But I think this time is calling us together as a community to support one another. And there may be strategies that we can devise together with our school systems that allow those who can remain home to remain home, or if necessary, when the virus is at a certain level, that everybody is home to protect students and teachers and other support system people. And when there's a different condition, the virus is lower, those with the highest priority can get back to the schools. So I don't have solutions, but I want us to know we have to work together during this time because it's not going away. And this is calling us to do things differently, perhaps a transformation of education as we have known it. So that's all I have. I'm available for questions, and I thank you for the wonderful work that you do and for the time that we've had here together and forward.
Dr. Fuller, thank you so much for those words and that important information. I think it was very critical that the reminder that we all have a stake in this, right? That we have to work together and we really have to, envision something brand new, right? And sometimes something new might be a little challenging, but we all have our place and we can all do our part.
I've heard the saying many times that necessity is the mother of invention. And so I think we're at a time where we can see this as, unfortunately, an opportunity brought on by some difficult times to think creatively and cooperatively, perhaps in the way that we should be thinking anyway, but because of the way things have been, we've gotten away from that. So I see it as a call back to or into a new normal where we really are our brother's keeper and we work together. Though I have no children, I have people I care about, and I need to be involved in the process of making it possible for children to safely get their education and parents to comfortably or at least sufficiently have the economical means to support their children and their families.
Thank you so much. That was great. Thanks for the reminder and thanks for sharing your expertise with us. I'm going to go ahead and pause because I'm sure we have a lot of questions for you from our audience. But just a reminder for those of you that are listening, if you haven't submitted your questions, you can do that on the Facebook chat, or you can text your questions to 313-288-2082. Christine, do we have any questions so far?
Yes, we do. We have a few coming in. And again, please continue to post your questions in the chat or text them as Cindy gave you the instructions of how to do that. Also, a survey is being posted in the chat right now. If you'll fill it out, you'll be entered into a raffle for a $25 gift card. So the first question, Dr. Fuller, is, do we have an idea of when a vaccine will be available?
Yes, great thoughts here. I was looking at information just today. There are 3 major vaccines that have reached the 3rd phase of experimentation. To answer the question, the predictions are moved a little bit closer to possibly having something that will reduce the amount of infection or reduce the probability by the beginning of 2021. Now that comes with a lot of caveats that we don't know how well any of the 3 vaccines are going to work in phase 3 trials, which means that a lot of people who get the vaccine compared to people who don't get the vaccine, and then looking over time for safety as well as effectiveness in protection. And then does that protection last? Is this going to be, if there is protection, is it going to be the type that lasts for a year or 2 years? Are we going to have to do it like we do the flu, where you get an annual COVID vaccine? Or is it going to be like measles, where you get, maybe one as a child and a booster later in life? So there are lots and lots of questions. A vaccine will be helpful. How will it be distributed? There are lots of unanswered questions. So I think what we have at the moment are the things we know that work in prevention, which is the things I showed you with reducing transmission, and then the contact tracing, which when someone is positive, to make sure that anyone they've had in contact is followed up on. Those are the things for sure. A vaccine, we're closer, but we're not there yet.
Great. And so you said we're in phase 3 of the vaccine. For those of us that are not familiar with vaccine creation or development, could you explain what phase 3 means to
Sure.
us? What that
So
means?
first of all, there are probably about 30 different vaccine trials. There's been a major push to get a vaccine. There are 3 that are working with companies. One is in Great Britain. There are 3 around the world that have gone through the phase 1, which is to show that it works. First it has to show that it has some protection in an animal model. Then it has to be shown to be safe in a small human sample where they get the vaccine and it doesn't cause problems. And then it has to be shown, phase 2, that there is some protection and not a great adverse effect in a small number of people. Then phase 3 is where you get to a large population that's diverse, that has different ages, different socioeconomic groups, different ethnic groups. And you look at that group compared to controls that have the same features. And so ideally, if something is working, you will see that the people that got the vaccine have a different outcome over time than the people who got the placebo or the false thing, who are still susceptible to whatever you're trying to get protection from. And those trials take at least 3, in a rush situation, take 3 or 4 months. It requires having enough people to go through that who get either the vaccine or the placebo. Oftentimes the experiments or the clinical trials are stopped if it's working so well, because it's deemed unfair to the placebo group not to give it to them. So there's lots of things that go on in the clinical trials that are yet in progress. We're just starting clinical trials, phase 3, for 3 of the vaccine candidates.
Great. Thank you, Dr. Fuller. We're gonna have to move on to our next guest. We might ask you if you could stay on. We might have you come back up because there's a number of questions about vaccines that just came in. So, Cindy, if we could introduce the next guest, and Dr. Fuller, if you could stay with us for just a few more minutes, that'd be great. Thank you. Cindy?
Yes, and thank you again, Dr. Fuller, for that great information. We're going to go ahead and go on to another medical professional right now, Dr. Fair from the Detroit Health Department. It will be on. So please go ahead, a reminder for you guys to please text in questions on the Facebook chat or text to 313-288-2082. Dr. Fair, welcome.
Hey, thank you so much for having me. Feel free to call me Denise. I actually am not a doctor, that's my sister. So I am the public health administrator, but thank you, Cindy. And also just thank you for inviting me to this forum. I was asked to spend just about 5 minutes giving my public health opinion regarding returning to schools. And just recently I was appointed to provide some oversight for the public health work group as part of the Return to School Advisory Council. And we spent many, many hours with a large team looking through over 300 recommendations for all of the different phases as we bring schools, as we bring students back to schools safely. So what I really appreciate most about Governor Whitmer is that every time she speaks about COVID and she speaks about students returning to school, she's indicated that she's going to allow the data and the science to drive her decision making. And I really appreciate that. And I'm following the same approach at the Detroit Health Department. We are a public health division, a public health department, and we are going to also allow the data and the science to drive every decision that we make. And so the Safe Michigan Start Plan was designed with that in mind in order to bring back students in a safe and equitable way. We spent a lot of hours making sure that students felt safe and also families, they also felt safe. This is a 63-page document. It's actually sitting over here. And it is full of a lot of information, data, FAQs by each phase. And so if you haven't already seen the 63-page report, please make sure you review it. All of your questions, the majority of them, I believe, will be answered there, and I really encourage you to take a look at it. If not, I encourage you to reach out to your local health department, because each local health department every week will be meeting with local schools. And so the Detroit Health Department, as well as the Wayne County Health Department, we've been meeting weekly for the last several weeks, and we've developed our own kind of return to school roadmap, which is based upon the return to school roadmap. Essentially, it's a little bit different, but we're providing additional guidance, and we're answering many of the questions that parents have been asking us, other local health officers have been asking us, schools, districts, and so we put it together in this really cohesive virtual binder. We talk about face coverings, about testing, health screenings, what to do when a staff gets sick, what to do when a child gets sick. We provide templates, different scenarios, so it's a really informative document. And also it says who to call for what. So if you are a Detroit student, you're going to call the Detroit Health Department. If you're in Wayne County, you will call the Wayne County Health Department. Now, quick kind of food for thought. I probably answer this question every day of the week. What is the difference between the Detroit Health Department and the Wayne County Health Department? Because Detroit is in Wayne County. And that's true. Detroit is in Wayne County, but we have separate health departments. So if you are in the city of Detroit, you fall under the Detroit Health Department. If you are in any other city that's in Wayne County, not including Detroit, you'd fall under the Wayne County Health Department. So I think this roadmap will be extremely clear. The roadmap will be finalized next week. We're making a few tweaks, and it'll be available for all of the schools, all of the districts, and the families, if they have an interest. They can also have this virtual binder. So in terms of my opinion, my public health opinion, I believe we're definitely taking the right steps to open schools. We're being extremely safe. This is not rushed at all. If you recall, COVID over the last several months, we were very much deliberate on the decisions that were made, of course, at the state level, but also at the local level. The same applies to the school. We will not be rushed. We're going to be really deliberate, again, to make sure that families feel safe before their students return back to school. We took a careful approach and made sure that the roadmap was clear in its guidance. I realize it's a hefty document, but it was really important to make sure all of the bases were covered. And again, I do want to just reiterate that all schools need to work closely with their health departments. Especially reach out to your local health officer, and that would be me. We are here to serve, and so make sure you call us, send us an email. I check my email. So send me an email. It's just healthofficer@detroitmi.gov. Again, healthofficer@detroitmi.gov. And I typically respond that same day for whatever questions you may have. And again, I encourage you to reach out if you do have specific questions. And I believe there's time now, if you can unmute your line and ask me a question. I may not know the actual answer, but I will encourage you to go to the Michigan Safe Schools Return to School Roadmap. And thank you again for the invitation.
Thank you so much, Denise, for that information. That was great. And I, as a parent, want to thank you for putting the safety of my children and the children of Detroit students first. So thank you for being so diligent in that work.
Sure. My pleasure.
So I'm going to go ahead and pause and see if Christine has any questions for you.
We do, they're rolling in. So continue to post your questions in the chat. And also there's a survey in the chat right now. If you fill it out, you'll be entered into a raffle for a $25 gift card. Denise, there's a couple of questions here related to how can we help teachers and students stay safe when they are going back? So can you just maybe do some really, what are maybe some of top 3 safety measures that are outlined in the plan?
Sure. So there's a lot of discussion about facial coverings. And so it's really, there's explicit guidance in the state level work plan. But I do want to make sure people understand that if you are in between the ages or the levels kindergarten through K5, facial coverings are not required when you are in the school setting. So when you are in the classroom, you do not have to wear your mask. Again, if you are pre-K through 5th grade, it's been a long time since I've been in school, so I forgot some of the names. But when you're out in the hallways, it's really important to wear your mask. If you are taking the bus to school, you are required to wear your mask. So that's really important. If you are above K5, so between 6th grade through 12th grade, you are required to wear your masks at all times except for eating. For staff, it's really important. Staff are required to wear their mask at all times. It doesn't matter if you're in the classroom or on the playground, you need to wear your mask at all times if you are a staff. Face shields is a really interesting topic. Facial shields, those are the plastic ones, and I usually have some over here, but I don't have any. That is not enough because face shields don't provide protection for when you are speaking, droplets are spraying. They can also spray downward. So it's really important. You can go ahead and wear a face shield, but you also have to wear a mask that covers your nose and your mouth. And let me just take the time to demonstrate how to wear one of these masks. This is a surgical mask. And when you wear your mask like this, this is a fashion statement. That's all this is. This does not protect you from anyone or anything. So it's important to make sure that you are covering both your nose and your mouth, and that's going to protect you. And also, one more thing too is sometimes these surgical masks can they're kind of flimsy, so you can double them up. And if you double them up, they'll stay put a little bit longer. So facial coverings is really important. And then also social distancing. So the classes, when you return back to school, the classes are going to be a lot smaller. There won't be 30, 40 kids packed, but it should be a limited amount of students. And we'll make sure that these students are spaced out so they'll practice social distancing. So those are some of the things I think are really important, and they're outlined in the return to school roadmap.
So there's a couple of, so this is a quick, just because the roadmap is there. Where can we find a summary of the 63-page report? Is there a place to find a summary of it?
So there's no summary of the 63-page report. The summary is the 63-page report, which is, it's a huge document. But as I mentioned, every local health department, we are partnering with our schools, and we're taking the information and we're providing it in a condensed format. So from the Detroit Health Department and the Wayne County Health Department, we put together, as I mentioned, a virtual binder, and it's about, I think, 12 or 13 pages. And it provides some high-level summaries, and that will be available. And we're deciding where that's going to be, whether that's going to be on the Detroit Health Department website or Wayne RESA. You'll be able to access it soon.
Okay, great. And then there's a couple of questions about testing. So I'm going to try to, people seem to be really concerned about how often testing should happen. So how often should kids and teachers be tested if they're in person at school? Is there a recommendation around that?
Yeah, so I'm not a physician, so I can't really speak to the clinical guidance regarding the cadence of testing. I believe that's still a conversation that is still being determined at the state level. I wholeheartedly believe that if you have symptoms, the first thing you need to do is to self-quarantine and then to call your physician to figure out next steps. At the Detroit Health Department, we have a variety of different testing options available to residents, not only in Detroit, but Wayne County, Macomb, Oakland. They can go to the state fairgrounds to get tested, and results are given within a few days. So I think that's really important. If you are feeling those symptoms, to immediately, again, self-quarantine, call your doctor if you would like, and then go and get tested at the state fairgrounds.
So, so there's a question around, and I don't know if you have any guidance around this, but how do we expect children to keep masks on at school? And then if K through 5 aren't expected to wear masks in the classroom setting, wouldn't that cause an increase in transmission?
So we are requiring that all teachers wear the mask, and we're requiring that they practice social distancing. So they should not be close to students at all. And I'm trying to make sure I'm clarifying my statement. Kindergarten through K5, or excuse me, kindergarten through 5th grade, they typically are around the same children every single day. They're not changing classes at all. And so that was decided, and we spent a lot of time talking about who should wear masks and who should not. And I wholeheartedly believe that kids who are a little bit younger are going to spend most of the time playing with their mask rather than focusing on learning. And so we did not make it a requirement. And you know, that could potentially change. But at this point, as long as the kids are spaced out, they're practicing social distancing, the masks are not required. Now, if your children still want to wear a mask when they're in school, that's perfectly appropriate. But that's not a requirement, again, for that age range.
Just a quick comment, washing hands, I've seen in some younger groups, it's also so critical that the routine washing of hands for that preschool and K through 5, even if they're not wearing masks, that process helps to keep virus transmission down. So those parents can encourage their kids to just get in the habit of doing that. And there should be sanitizer in the classrooms where they can do that sort of thing. And I think Denise would agree with me there.
I agree with you. Mm-hmm.
So there's a lot of questions here. So how do we ensure teachers are safe in K5 if they're not required to wear masks, particularly if they're asymptomatic?
Yeah, so once again, so I want to make sure I'm really, really clear. So the teachers are required to wear their mask. So they cannot,
always.
Yeah, so always at all times, except for meals. If they're, eating, of course,
Right.
They don't have to wear their mask. But at all times, and this is explicitly stated in the return to school work plan. I can pull the page number in a few minutes. But again, as long as they are practicing social distancing, we know from the science that if you wear a mask and if you practice social distancing, the risk of transmission is extremely low. And so that is the guidance for that particular question. But again, if you want to make sure that your kids wear masks at all times, that's up to you as a parent. But again, that is not a requirement.
Will there be a contact tracing plan for each school?
So contact tracing is at the state level as well as the local level. And so whenever a student tests positive, the process is for the health department to follow up accordingly. And yes, there is a robust contact tracing plan. It's at the local level. Each school should make sure that they are partnering with their local health department. I received a work plan from a school the other day, and they did not know that Detroit Health Department was their main contact. They had no idea who to contact. So it's really important that if you don't know, again, if you don't know who your local health department is, let me be very clear. If you live in Detroit, if your child goes to school in Detroit, then they would follow up with the Detroit Health Department. If your child is anywhere else in Wayne County, not including Detroit, then you would follow up with the Wayne County Health Department. And they're gonna call you directly.
So I'm gonna, 2 more questions, one for Denise and then one for Dr. Fuller. What happens, so what is the quarantine protocol if my child's teacher has had COVID? Should I take my child for a test? What are the age differences for this, for preschool versus high school age? If there is someone that tests positive, does the whole school shut down? Does the class, is it just one class that gets, does the whole class get tested and then do a 14-day quarantine? So really the question is, what happens if someone tests positive?
Yes, so I think that is a great question. And all of the guidance is in the Michigan return to school work plan. But let me just kind of give you a couple different scenarios. I know we're running out of time, but I think your question was if a student has tested positive for COVID, or was it a teacher?
Child or teacher.
Okay, so if a child, and this is specifically stated in our Michigan return to school work plan, if a student or staff person has been confirmed with COVID, and I'm just reading this here because I want to make sure I'm clear, the student or staff and all of the household members are immediately excluded from school. So if you are a teacher and you've tested positive, you should not be coming to school at all, obviously, or if you are a student. And so the confirmed person must isolate directly at home, and the student must not return to school until it's been 10 days since the symptoms first appeared and at least 24 hours with no fever. So again, you're isolating at home. It has to be at least 10 days since symptoms first appeared and at least 24 hours without a fever. And also respiratory symptoms have improved. So there should be no coughing, no shortness of breath. And that is the recommendation. So again, make sure that you take a look at our Michigan Safe Start plan for additional scenarios, which will be able to respond to your questions appropriately.
Yeah, so Denise, we could probably pull those scenarios out and then maybe post them. I think for some folks, I was in my head, I'm thinking we should create some memes because you know, we have such a short attention span, and particularly in this very difficult time, I think many of our attention spans are even shorter. But I think maybe we should pull out those scenarios for folks and put them on the Detroit Public Television website so people can see them. One last question. This is, and I still want to get to Dr. Fuller's question, but which infectious disease doctors consulted on the state plan? Or were there infectious disease doctors that were consulted on the state plan?
So I'm sure, so I'm sure there were. In fact, if you go to the 63-page report, the first page 4, 5, and 6 has over 100 people that have been listed. This is the Return to School Advisory Council, the Task Force on Education. And as I mentioned, Governor Whitmer does not operate in a vacuum. So she has a team of infectious disease and epidemiologists and public health professionals, Dr. Jonay Caldoon, who's an emergency medicine physician herself. So I imagine there was an infectious disease physician. And if you punt the next question over to Dr. Fuller, I will look through this list and I will let you know who was consulted, okay? I'll put myself on mute.
Yeah, no, and then Denise, if you want to put it in the chat, we can take it out of the chat and share it in the Facebook chat. Thank you for looking through a list of 100
No
people.
problem.
We appreciate that. And then Dr. Fuller, I hate to put you on the spot, but somebody very specifically asked this to you. Dr. Fuller mentioned she doesn't have kids, but if she did, and you do have children, they're just older. I know that from previous town halls. But if she did, would she feel comfortable sending them back to school?
I have adult children, 26, 26, and 34, and no grandchildren. I have lots of friends with young children. I am telling them that if they can manage to work it out within their homes, within their grandparents and aunties and aunts, or their neighborhood, people they trust who they know have been tested or quarantined or sheltered in, I am saying if you don't have to do it, don't send your kids to school. If you can do the education at home, even if it's difficult at this time until the virus is much lower, then please try to do it at home. And that leaves more space for those who don't even have that option to function more safely in the schools for the teachers and the students.
So suggesting to folks that if they can do virtual at home, they should try to do the virtual at home.
Or if you're like me and you don't have children, but you can support somebody else's children, even if it's a couple hours a day, that is a contribution to the overall process. And we're working with people to do that from our own family and church family.
Thank you, Dr. Fuller. Thank you, Denise. This information is very timely and certainly critical as a parent that just looked at the overview of our of the school's plan. This has been so helpful to me and hopefully to our viewers because these are really hard decisions. So thank you for sharing your knowledge and helping us to make our decisions based on science. Cindy, who's up next?
All right, guys, so now we're gonna go ahead and transition to our education section. So we are gonna invite our folks from different districts to talk a little bit about their reopening plans. So first up, we have our friend Charlanda Buckman from DPSCD that will give us an update on how the district is handling the reopening. Charlanda, welcome.
Hey, welcome. If I can get my computer to act right today, I was beginning to get the impression you all didn't want me here because I couldn't find the link, but
we always want you. You know you're always welcome. Thank
no, I know that I'm among friends. So one, I actually enjoyed being a participant and really enjoyed Dr. Fuller and listening to Ms. Fair in terms of stuff that I've been reading, but it was just nice to hear it verbalized by our professionals. I think what I'm going to do on behalf of Detroit Public Schools Community District, we have had some regular sessions with parents just to kind of keep them abreast as to what is happening with our reopening plan. Obviously for us, safety, the health and safety of our students, of our staff, or of our families are at the core of everything that we're planning to do in the fall and that we're actually doing now. And so for those who have been following, we began this process listening to our parents, listening to our teachers, having sessions with our unions and every stakeholder, community members, community organizations, our faith-based partners. And so we have certainly developed this plan based on the state's guidance, based on recommendations from the CDC. We are working very closely with our local health partner, which is the City of Detroit Health Department. And so we feel very good and confident about what we are rolling out for our families come this fall. So I'm going to hit some highlights because I think that's what people want to know most. So one, you will be getting a survey in the next several days that will give you an opportunity to decide if you want to have either face-to-face instruction for your children or if you plan to choose the online learning option. You will also have an opportunity to change your mind several times between now and probably what will be mid to late August before we finalize how children will be positioned based on what their parents choose for them for the fall. And that just gives us as a district time to plan and make sure that we're able to accommodate what our families are choosing for their children. So just to really at a high level in terms of understanding what your choices are. So for K-8, you have the choice of face-to-face or online. There is some discussion for a very large K-8 schools to potentially have some AB schedules, which right now only applies to our high schools. Right now it's just face-to-face or online for K-8. For our high schools, we are going to facilitate an A/B schedule. So for instance, if your high schooler goes to school Monday, Wednesday, and Friday, they will probably do their online learning Tuesday and Thursday, or if they go in person Tuesday and Thursday, we'll do their face-to-face Monday, Wednesday, and Friday. So those are the options now. Another piece that we're working on, we have educators from every grade band for our Montessori schools to actually put together an online offering so that we can offer the same thing for our Montessori parents, either face-to-face or online learning. So again, our plan continues to evolve in terms of what we're offering families based on what they are telling us they want. Also based on what guidance we get from our partners in developing this plan from the state, from our local health department. Some of the other things that have come up the last several days in talking with parents is how are we managing our students? How are we implementing social distancing and those kinds of things? All of our buildings, we will have customized school by school plans based on what their capacities are now. And when you overlay social distancing, what that capacity looks like then. So we may have some limitations on enrollment at various schools based on their new capacities in the context of social distancing. Another question that I've gotten often from parents is that our children aren't wired to just sit in a seat all day. I think another thing that parents want to know is that there will be breaks that will happen often, because we understand that children aren't just going to sit still all day. So there'll be regular breaks, more frequent breaks over and beyond their lunch period and recess and those kinds of things. And we see that playing out now, even in summer school, where we have teachers who do dismiss children in small groups, and they are socially spaced in the hall where they can do jumping jacks if they want. That might be an extreme, but they can stretch and they can get their energy out, is what I called it for my kids when they were little. Get your energy out. Well, my 11-year-old still gets her energy out daily. So there are concessions, and we know that especially for our K-5, that will be somewhat disruptive, but we just encourage the frequent breaks as teachers will move, not students, in order to protect our students and also our staff. Those are some of the high level things that I can share today in terms of what the district is thinking. We have a regular way for you to give feedback within our plan. You can go to DetroitK12.org/reopening, and you can regularly share feedback, thoughts, concerns as we continue to plan and move forward. But I will pause there just so that we can get at if there are specific questions from our parent community that I know is represented here that we can address.
Thank you, Sherlanda. I know you are very attuned to what parents are asking for, and I thank you for that. So I'm going to go ahead and pause, because I'm sure there is lots of questions for you. Christine, do you see any questions for Sherlanda?
So there's some that are coming in. I'm going to ask one, and let's have, because some of the questions that are coming in are both for DPSCD and for charter schools, but this one is actually specifically to you. Why did some schools open during the summer if there wasn't enough PPE? Will this be fixed in the fall?
Yeah, to my knowledge, we don't have schools that don't have enough PPE. And we expect to fully supply those resources to our staff and students in the fall. So it's not a burden that will fall onto our parents, but we have ample PPE supplies. One of the things that has to happen in the fall is, and that has been instituted now as all of our central staff have come back to work, is we have temperature checkers installed in many of our buildings now. Will be all of our buildings come fall engagement, where before you can enter the building, your temperature is checked. We have ample supplies of masks and hand sanitizers. We have instituted hand washing stations in high or frequently used areas. And so, I'm not sure where that came from, if there's a specific school or issue. I would just offer my email, sherlanda.buckman@detroitk12.org, if you are interested in talking further. But, when we opened for summer school for our students, we were fully prepared with those items for our students and our staff.
Thank you, Sherlonda. And I want to encourage whoever did ask that question to please reach out to Sherlonda if it is a school and they have firsthand knowledge of that, to please share that with her so that she can take that back to the district. There's one more question that's specifically for DPSCD. Thanks, Cindy. Given the judge's ruling, how is DPSCD going to ensure that all children in summer school will be tested before returning to summer school? Is this going to occur for face-to-face classes in the fall?
So that's a good question. And one, we are going to comply because it is a judgment that, obviously we're going to comply with it. And so we have partnered with our local health department. Testing is happening now. We began some yesterday in terms of making sure that parents were informed that they could give their consent, and the health department is administering those tests, which we get the results within 30 minutes. That said, I will say at some point for parents who are listening, this has to be the choice of parents. The district has not been opposed to testing our children, but it is about having a public conversation such as we did with water and other issues around facilities that we have had in the past in this district. We've had a very public conversation, engaging our stakeholders, engaging our parents, and jointly deciding what we do for our children. It doesn't feel good that we have a standard set for Detroit children and not set for all children. But because we don't want this to be an impediment for our students and our parents who are choosing face-to-face, that testing is happening now. It'll continue to happen. Again, just to support our parents and to follow the law, if you will. It is not clear whether or not that will be something that is imposed on Detroit-only students in the fall. I would submit that that is an ongoing conversation, and so we don't have a definitive on that yet.
There are a few more rolling in for you, Sherlonda. So we know that prior to COVID, DPSCD and other schools, other districts were struggling to have soap and toilet paper in bathrooms, and parents were providing tissues and Clorox wipes and things like that. Now, post-COVID, how has the district addressed that? Because these are obviously things that now we have to have.
Well, I would also say pre-COVID, I mean, we know that there are sometimes issues here and there. We instituted before COVID a reporting number so that our students, our staff, and families could report if there were issues. And so that has been going on for a while, Christine. It's not something new. We're very conscious of making sure our schools have the supplies that they need, and there's no reason why they shouldn't, quite honestly. And that's been working well. We do get reports if schools are running low, if there's an issue. And so I would say we put in a mechanism to actually monitor that. That was long before COVID. So I just want to make sure that piece is clear. The second piece, and I'm actually wanting to post that, I'll post it for you shortly, is we do believe in accountability. Through this process, we want to make sure that we don't just talk about the things that are being offered, but that they are consistently practiced, because it is about health and safety. And so there will be monitoring of that by different individuals. And we also have a reporting number for that, which I will share. It is 313-578-7018. That number will just continue into the fall. And so if you are at a school and you see that there's an issue or something's not happening consistently, you can use that number to report it, and within 24 hours you will get a response. So we are not only in compliance with the state expectations, we are not only instituting all of the practices around reopening, we are also putting in accountability mechanisms so that people have a way. We want to be accountable and to hold us accountable if those things are happening.
Will you repeat the number one more time, Sherlonda, so that we can take it down and put it in the chat?
Sure, I'll also put it. It's 313-578-7018. And then parents can also email, and I'll send this to Terry as well, and that is info.reopen@detroitk12.org. So I'll post both of those, and you guys can post them as well. But again, it's another way in which we're holding folks accountable to ensure we keep our students and our staff safe.
And so one last question, what has been the feedback from the parents whose children are in summer school? Has it been positive? And then is the district administering, this says weekly surveys, but is there some cadence for surveys?
Yeah, I think the feedback we've gotten so far has been highly positive. I think one of the things that I've heard specifically from parents is, one, they needed their kids to be safe because they had to work. Two, there were many children who wanted to go back to school. So they had conversations and made that decision together as a family. As mom was saying, then she had to say, you know, that means you have to wear your mask and all these other kinds of things. So people are making the decision and having discussions and now experiencing school right now. Another piece of feedback that I got was just watching their children learn the health and safety practices that we have in place in terms of social distancing and wearing your mask and the frequent hand washing, and then coming home and continuing to practice that and emulating that for others. And so we've seen some very positive effects of doing what schools have traditionally done. They've been safe havens for children, especially for our parents who are working multiple jobs and have multiple responsibilities in their families. And children do emulate what they see and practice at home. At school. Well, it works both ways, right? Seen, as I was gonna say, because it does work both ways. They have seen that the impact of that fold over into their homes as well, and that's been a very positive feedback that we've gotten. Yep.
Great, thank you so much, Shalonda. Cindy?
Absolutely.
Yeah, thank you so much, guys. I appreciate the conversation. We're gonna go ahead and move the conversation to hear the perspective from our charter schools to see what it is that they're doing, how they're any updates that they have to share. We're going to invite Rajeshri back. She was on last week, and we're glad to have her back this week to give us any updates. Rajeshri, welcome back.
Thank you. In the interest of time, I will just kind of give a big picture overview. I think a lot of what Charlonda said matches what you see happening in charter school buildings, because ultimately we are all following the same guidelines, have the same interests of students and safety and, at the forefront of what we're trying to do. So much like she described in terms of how buildings are getting set up and schedules are being made, I would say that the same thing is happening within all of the charter schools in Detroit as well. A couple of things from talking to many of the charter school leaders, most schools are in response to parent feedback, which most schools have been hosting parent town halls throughout the summer, and we'll continue to do that through August in order to sort of continue to get the feedback from families and say real time. Most schools are offering an option to parents, depending on what their comfort level is, and like Charlonda said, we also recognize that parents may change their minds, and we welcome that. And when I asked, schools, okay, so if a parent chooses, say, a virtual option, is that a choice for the whole school year? Is that a choice for a period of time? Most of the schools have said that the choices that their parents are making, they're committing for a marking period. So it could be a quarter, could be a trimester, something along those lines. And so my suggestion is, as parents, if you talk to your school, find out how they are managing these kinds of things so that you have the most up-to-date information for you. The other thing that's happening is a lot of collaboration. Charter schools are each independent bodies governed by independent boards. So on the one hand, it's, each one's independent. On the other, that means that we have the benefit of a tremendous amount of information and resources in the form of perspective. And so as we think about all the different charter school board members and all the different schools sort of working on plans, one of the things that we've done as a charter community is find ways to come together so that we can share some of what we're doing. And that way it's, if somebody has a good idea in one school, we want to make sure that it's shared with all schools so that everybody can take advantage of that collective think. And that's not just in the city of Detroit, that's throughout the state. So our team is hosting meetings with school leaders and others from charters across the state to sort of start to get ideas of how are folks managing this. Understanding that the regional piece of it is very important because obviously we are tied to the regional phases of the Safe Start. And there's also potentially differences between regional preferences from parents, but we want to make sure that every idea, is shared so that we can all have the benefit of of knowing, having a large variety of tools in our toolbox, if you will. And the last thing is, we recognize in this, for parents, that this is really hard. I mentioned last week, I'm the parent of a rising kindergartner. And so every day I feel like I have new information. And, even as somebody who's so deeply involved with this work, I honestly, sometimes I change my mind on a daily basis about what I think I want my child to do. And it's not because I don't think the school can keep her safe. It's just because as a parent, that emotion kicks in. And I just wanted to remind parents that that's very understandable, and that whatever choice you make for your family and your child is the right choice. Please don't feel judged. Please don't feel, like, hey, I'm not doing right by my kid if I choose one or the other. At the end of the day, we all recognize that we all want to do what's best for our kids. And that involves us doing our own soul searching and making that choice. And just know that all of our schools, regardless of governance model, are here to support you in doing that. So thanks. I'll welcome any questions as well.
Thank you, Rajeshri, and thank you for that message of support and understanding for parents and everything that we're dealing with. Because it's 63-page report on back to school. It's kind of daunting, and it's like, this page seems great, but I don't know about this page. So thank you so much for that.
As somebody who contributed to making that report, even I struggle to get through it myself. So I understand.
Thank you. I'm going to go ahead and ask Christine if there's any questions that we have in queue for you. Christine?
Yeah, so I'm going to just ask a general question. What is the expectation for PPE, specifically masks, for children that don't come to school with them? Is it a mask every day, or is it limited? So what is the expectation of schools giving PPE, specifically masks?
Again, it's going to be a question that you'd want to ask your school specifically, but the guidelines state that it must be a new mask every day. And if it's a reusable mask, that it is washed every day. So my understanding is that schools are working with parent bodies to figure out what the school needs to provide and what parents are able to provide. But at the end of the day, much like anything else, if it's part of the guidelines. So we have to make sure that students have what they need to succeed in school.
Thank you. And then Shalonda, what is DPS's? Go ahead.
Yeah, the expectation is that our kids will have masks, a supply of masks for the week, and there will be additional masks on site, because we know children lose their masks. They bought it up, they threw it away, they don't know what happened to it. But we are planning for them to have a supply for the week each week. So again, all of the plans that I described are evolving, which is why we're doing regular updates each week. But on that specific issue, we're planning for that supply.
Great. Thank you, Shalonda. Cindy, what do we have up next? Thank you, ladies, so much. This was really helpful. Thank you.
Thank you.
Thank you, guys. So now we're going to go ahead and pause, because we have the honor to have a pretty dynamic voice from a parent leader. We have Ms. Elizabeth Gonzalez that's joining us, and she's going to share her perspective of reopening and a few words with us. Elizabeth, welcome.
Thank you. Good afternoon, everybody. My name is Elizabeth. I am a COS for Hope Starts Here through District 6. I'm here. I'm also as a parent and a grandparent in the District 6. I'm here also to talk about things that I have accomplished. I'm a little nervous. This is the first time. Okay, let me see.
You're doing great. Thank you, Elizabeth.
Okay. There you go. Things I have accomplished is making sure that with Hope Starts Here that we give out resources to our families that are in need. I make sure that they have all the resources and that they're accurate to them and convenient for them and their children. Throughout the pandemic, I've also been delivering lunches to about 50 or more families that need it here in District 6. We also do early childhood. I also encourage parents to be their child's advocate. through this pandemic, it's been really hard for the parents and for children to be home. So I really encourage everybody to practice like their 6 a day with their children. It's 6 a day, every day, all day. We do one, we encourage our children, hug your child, talk to your child, sing with your child, read to them, and also play with them. And 6 a day has become a very important part right now through this pandemic with your children. Just because they don't know, what's going on. I know it's been kind of hard for myself and for my children, on why, we have to wear our mask and why we have to follow these regulations and stuff like that they're providing for us to do. So we tell them, we want to be safe and we want to keep people also safe and stay healthy, and everybody, that are close to us to be healthy. I just encourage everybody to stay safe and healthy and wear your mask. And you can find Hope Starts Here at Hope Starts Here Detroit on Facebook, and on Instagram at Hope Starts Here, also on Instagram. Thank you for having me today.
Elizabeth, thank you so much for that reminder to like pause and really think about, our capacity, our ability to fit in and help others, help our kids, right?
Yeah.
The 6th day is so important. And I think that little reminder was very great. Thank you.
No problem. Thank you for having me.
Okay, guys, so we are reaching the time to wrap up. So I'm gonna go ahead and pass it over to Christine, because that is it for our speaker lineup. Christine, would you close us out for today?
Thank you, Cindy. Sure will. So we're at 1:11 and we're going to wrap up. Thank you to all of our panelists, and thank you to each of you that have joined us today. If your question wasn't answered, we'll get the answers and post them next week on on onedetroitpbs.org and on DPTV's Facebook. To sign up for regular updates, please fill out the form that is in the chat right now, or you can put your email or your phone number in the chat, or you can text us your email or phone number at 313-288-2082. Again, that number is 313-288-2082. We also want you to know that we're going to be doing shorter programs. We're trying to keep them to an hour, which has been difficult when we have really important topics that we need to talk about. But we're doing this because we want to better accommodate families and to make sure that you're getting the best information in a shorter period of time. On the 4th of July, our community, specifically Southwest, but Detroit in general, there was a great loss. We lost the parents of the Gonzalez family, and they were murdered. And their 3 boys are left without their parents. That would be difficult in a regular situation, but COVID and all the decisions that parents have to make right now, they don't have parents to help them to make those decisions. They do have a very, very loving family and a support network, but we just wanted to share the GoFundMe that the family has put together for the boys, and so if you can give, please give. They need us right now. They need the whole community to wrap around them, as they wrapped around the community when they were here. They cared for parks and made sure that kids had a safe place to play. So we are going to dearly miss Maria and Francisco. We do have a few asks before you go. First, please visit Vote 411 to register to vote online. The primary is coming in August. It's incredibly important that you register. It's incredibly important to vote. So you can register in person to vote until August 4th So that is the election at your local clerk's office. And if you have up until July 31st to register online for an absentee ballot. So July 31st to register for an online for an absentee ballot. You can register to vote in person until August the 4th. There is a link in the chat to the online absentee request, and for an absentee ballot, I am not going to read that off because no one is going to catch it. So it is in the chat right now. It'll also be posted in the places where we post the questions. Second, please take about 2 minutes to fill out a parent survey that we're putting in the chat right now. The first one is from 482 Forward. It takes about 2 minutes to complete, and it's the 482 Forward's community survey about reopening schools, and we want to know what you need and what you want as it relates to opening up schools. This survey literally takes 2 minutes. It's in the chat right now. There's another survey that we're putting in the chat, and that survey is a little bit longer, but also incredibly important. That survey is also trying to gauge how parents are feeling right now in the middle of the summer as it relates to schools opening, but also what parents need as it relates to childcare and out of school time programming. So please, if you can, take a few moments to fill that out. Also, the survey is being dropped in the chat one more time. And that survey, if you fill it out, you'll be registered to win a $25 Visa gift card. And we also want to know what you want to hear about. So if you have topics or experts that you want to hear from, please put it in the chat right now or text us at 313-288-2082. And as always, the town hall is truly a group effort. So if everyone could turn on their videos right now. And we want to remind everybody to stay healthy and stay powerful and stay strong. Cindy, can you please translate that into Spanish?
Manténganse saludables, manténganse seguros y manténganse poderosos.
And Saeed is not on, so he cannot translate it. So we hope everybody has a really great rest of your day and a really good week, and we'll see you next Thursday. Thank you.